For people that are here early, just let me know if you can hear me. Me starting about 15 minutes or so. Give a chance for people to come in and just kind of troubleshoot. I also want to check the chat if anyone can just type into the chat. Hi, Marcia. Can you hear me? Thank you. Thanks for coming in early. Do you guys see the chat screen, or do you just see the slideshow? Do you guys only see the slideshow and me in the right corner? Is the sound okay? Okay. Thank you. Thank you. We starting about 10 minutes. How's everyone? How's everyone's morning? Huh? I hear my voice in the background. They're just chatting with that one.
Come on, we'll get to see the chat. Yeah. Oh, that's it. Everyone can see it, right?
Wow, I'm on TV. Awesome. How's everyone's morning? We'll give a. Oop. That sound is gonna. I keep hearing my sound reverberate back into me. Turn on the volume. You hear myself? We'll give about 10, 15 minutes for latecomers to come in. So this is gonna be a long one, everyone. We've got a lot of slides. We're going to be starting over with just an overview for a lot of the new people that weren't here in the first time, and for people that were here for the first time, we'll just do some recap of some of the things from before, but lots of new material, a lot of new questions coming in from people all over the world. So we want to again try to be as comprehensive and as thorough as possible. And today is going to be very exercise based. So again, it'll just be some recap stuff of things we talked about in the first webinar. People that want to know more about the things we talked about in that first one, they can check our social media accounts so they can see all the various things we talked about in the first set of clips. But this is going to be more geared towards exercise based, but we're gonna cover some important topics that keep coming up, things like the medications and pharmacology and stuff like that. So Anyone here, who are the first timers on this webinar? Anyone here for the first time? And who's here for the second time? Who's here on the first one? Just type into the chat. Let me know if you guys were Brenda, first one. Cool. Welcome. Twee, my wife, second time. Eliza, first timer. Welcome, welcome. Marcia, second time. Yeah, a lot of first timers. So we will definitely have to do some overview of who we are and how we got to this point. And then again, this is going to I don't want to redo everything we did on the first one since we have a pretty lengthy webinar on the first one, but we are going to cover a couple of new things, a couple of follow-up things that we didn't quite get to on the first webinar. So I'll just go into greater depth about some topics. And again, today is going to be exercise intensive, just going to be going over a lot of different form, technique, progressions, just some of the big picture principles that underlie a lot of the just the confusion I think that people have around this exercising with this condition. What's safe? Judy, first time Las Vegas. Shirley's from Dallas, Fort Worth, Texas. Very cool. Very cool, guys. Really glad people are here spending some time with us on a Saturday. So very grateful for everyone. Davis, very cool. Just a little bit further up north from us. Welcome. Yeah, so we'll just hang out for next, let's see, another 10 minutes or so. Montebello, Mary's from Montebello. Welcome. Brenda's from Toronto. Welcome. Welcome from up north. Neighbors from up north. Is everyone having a good morning so far? Everyone's having a nice Saturday. Karen Pleasanton, very cool. Naren from Pleasanton as well. Access to the slides. I'll give access to the replay for the webinar. The slides are like this gigantic file. So I'll have to like find a server for it. But what I will do is I will post all sources cited, research studies and things like that. I will post those on either through email or for people that request them. Anything that we talk about, we will make sure that everybody has access to the source material when we start talking about things like research, pharmacology, and stuff like that. So we'll make sure everyone has access to that. Pleasanton, welcome neighbors. Welcome, welcome. Tanya's from Las Vegas. Very nice. Hot over there, Tanya? Another 8 minutes or so. Thanks for everyone who has come in a little bit early. Make sure you guys save your slot. I think we ended up at over 1,000 registrants for this one, so this definitely definitely bigger than the first one. So we'll definitely be expecting a bit of a crowd, I'm sure, on this one. So thank you all for attending. Thank you all for coming here on a Saturday. Means a lot to us. Yeah, we're gonna send a replay 110 yesterday. That's brutal. That sounds brutal. We're going to be sending a replay. This is we're going to be going over a lot of stuff. This is also going to allow me to we're going to post a lot of clips because there's a lot of different little chapters and sections and stuff. So we don't anticipate anyone being able to absorb and digest everything that we're going to go over today. If cool, great, but we're going to make sure that people have access to all the material that we go over today. You can watch it on repeat. You'll be able to watch it in kind of shorter clips. If there are some sections that you feel are more relevant that you wanted to go over again, we're gonna make sure people have access to all of that. So no worries if you felt like you wanted us to go over a section again, or if you uh, just want to review things again. Again, no worries. We're going to be sending the replay to everyone. So 1 second. I'm back. Okay. Give it like another like 2, 3 minutes. Hey everyone, it's about 10 o'clock. We'll get started. Newcomers can come in at any time, but we'll definitely get started. So welcome everyone to, actually, let me just make sure this is recording. Sorry about that. Okay, cool. Now it's recording. All right, everyone, welcome to the our second webinar, the Strong Bones Blueprint. We are really guess excited that people are here, but also, under the conditions that people are here, talking about a serious health condition, something that we definitely don't take lightly. So, we want to make sure that we let everyone know who signed up, for this webinar, who's here on a Saturday, know exactly who we are, what we do, what we stand for, and just to lay out our entire, just kind of case for what it is that we do, how it is that we help, and then just kind of share everything that we know with regards to bone health, with regards to osteoporosis, and more importantly, just what it takes to just be able to move well, be strong, and just stay as active as possible into your 60s, 70s, and 80s. So, welcome everyone. Thank you all for tuning in from all around the country, locally, from some people around the globe. Very grateful for this opportunity, and yeah, thank you all for being here. So welcome everyone. I'll have the chat open here and there. We may take some time out every now and then just to take some Q&A. So the first thing we're going to do again, because there are a lot of newcomers, is we're going to just do some review of the first webinar. The first webinar went 3 hours, so we're definitely not going to you're not going to be spending 3 hours going over everything. But I do think that there are a couple of important topics that we should be hitting that are on a lot of people's minds with regards to things like, medications, loading and exercise, and just some of the research, so that people understand that we're not just coming at this from a point of some random place that we do this with clients. We are, heavily, deep into the research. These are things that we do not take lightly. So we want to make sure that everyone is on the same page with where we stand, and also we want to be open and honest with things that we don't know. We don't know everything, and we want to make sure that people are clear on the things that we do know and the things that we don't know. So, any questions come along the way, just type into the chat, and then we'll try to answer things as we go. So welcome everyone. Let me just get one more sound check. If anyone can just give me a thumbs up or just type like one or a yes if the sound quality is good. I want to make sure that again everyone can hear me and loud and clear. If it's too loud or if it's too soft, just let us know. Okay, very cool. Thank you very much for letting me know. All right, so the Strong Bones Blueprint. This is a safe strength training for bone health, and this is a clinical approach. All right, so let's start. Thank you all for being here today. None of this was expected. Again, we are just a very small little clinic located in Dublin, California. Some of you guys have come checked us out. You know, it's just me, Tui and Teddy, and just a couple months ago, we just started posting some clips from inside of our walls, from inside our clinic, and because we thought that there were some clips of moments that we thought were pretty cool and inspiring. And very gratefully, graciously, some of our clients actually let us share some of this footage in some of their stories with us. And that's pretty much what's happened. We're still kind of playing catch up. We're starting to kind of figure out, what's going on, with this newfound attention, all these people kind of asking us questions and just kind of letting us know about what's going on out there in this bone health world. And again, 3 months ago, doing global online workshops weren't really on our mind. But again, just because of the demand, because of the attention, just because of all of the positive words that people have said, that a lot of our content has helped you guys. That's what motivates us to do this. So that's why we're here. So thank you all for being here. If it weren't for you guys, we wouldn't be doing this. But we hope that you guys are able to find this information helpful and useful to help you navigate this diagnosis. So, all right. So I'm just going to breeze through. These are just some highlights from our previous workshops. So I'll just kind of skip through some of the more stuff that I don't think should be relevant. But let's start with who we are. So who are the people behind Balance and Body Restoration? Who are the people behind the scenes that you see on some of these clips on social media? So first off, this is our family. Right here is my wife Twee, our son Maddox, our daughter Madeline, and Teddy. And also here is our daughter Destiny as well. So this is the family behind Balance and Body Restoration. This is us. We're just a small little family-owned clinic. Again, it's just me, Twee, and Teddy here in the office. So again, just a small little clinic. Here is us. So my name is Dr. Kevin Mao. I'm a physical therapist, and together with my wife Twee, we founded Balance and Body Restoration in 2018. And Teddy, our dog, sometimes you'll see in our social media. He is our chief morale officer. He is our greeter, client relations manager. He has a huge role here at our clinic. People, I think they come to see us, but then they stay to hang out with Teddy. So that's the team. So welcome everyone. Okay, so what do we actually do? So I just want to be clear about just for the newcomers, so you guys have an understanding of who we are and what we actually do. We are not a gym. We're not personal trainers. We are first off a pain and complex injury rehabilitation clinic. We use an integrated multidisciplinary approach. Again, for the past, since 2018, we've specialized in treating very, very difficult cases. People with severe chronic back pain, hip pain, herniated disc, degenerative disc disease, post-surgical rehabilitation, total knee replacements, knee arthritis. That is the core of what we've done for the past 8 years. We're going to be talking to you about how we got to a point where we start talking about bone health, but we just want to be clear about kind of our background and what our clinic, has been for the past 8 or so years. Okay. Um, and so this is what happened because again, as a pain and injury clinic, we started to obviously work with people who are in pain. They have difficulty walking, doing the things that they do throughout the day. And so they'd come here and we try to help them get better. And once they got back to their normal, they finished. But then, some of our clients were, health conscious. They wanted to do more. So after they'd be done with us, they'd go out to a gym, they start doing exercise classes, or they'd start working with a trainer. Then unfortunately, they'd find themselves hurt again. Because they didn't really have a structured program to really maintain their progress, many of whom had to come back. And then at some point they asked us if we did training, and we said, sure, we definitely know how to train people. That's within our scope. So some of the clients that started with us in pain came back to us with another injury. They just chose to stay on with us for just ongoing training. All right. And this is one of them. I think a lot of you have seen Pam's journey with us. So she is one of those clients. She started with us for back pain and shoulder pain, and as you can see here, over the course of the past couple of years, we actually got some data back from her DEXA scans showing that she did, increase her bone mineral density score from negative 2.7, which is below the osteoporosis threshold, back up to 2.3 because of the training that we said that we started doing with her. And I want to be clear that she actually wasn't really coming specifically for bone density training. She just came to us again. She didn't want to hurt when she worked out. She did want to get strong. She just wanted to be able to be capable, well into her 70s and just be able to live her life. And again, she started with chronic back pain and shoulder issues, and she stayed on with us to get stronger, despite really having like zero weightlifting experience when she started with that 68. Um, and we through our program, we kind of reversed her osteoporosis, or if you want to use that terminology, it's it went in the other direction. I should say above into osteopenia. Kind of did on accident, to be honest with you guys. And it's because obviously the program that we do is very intensive. It's very challenging, and it took her 3.5 years to build it to where she is now. All right, so here I want to talk a little bit about myself and just why I believe, I just want you guys to know why we are talking about bone health and just where I started off in my career as a student and where we are now as a clinic. So I went to undergraduate at Penn State. I graduated with a degree in kinesiology. And part of the research I did as an undergrad, I was just an assistant in a lab. We were studying the effects of the lack of gravitational load on bone density in astronauts. We were also measuring the effects of various astronauts having issues regulating their blood pressure in the cockpit, just to do all the problems that happen to people who are in space, just the lack of gravitational load. And then that turned when I went to Boston University, where I got my doctorate in physical therapy. I graduated 2011. I did my practicum research on the long-term side effects of fosamax, bisphosphonates, in studying atypical femur fractures. I developed a screening tool for physical therapists to identify risk factors for atypical femur fractures for the population. All right. I then spent several years as a staff physical therapist in San Francisco, working on chronic pain, complex injury, worked on, post-op rehabilitation, working with some of the best physical therapists and orthopedic surgeons in the Bay Area. And then 2018, I started the clinic with my wife, who is a massage therapist. And she also takes care of all the back end, behind the scenes work with our office. So none of this is possible without her. And then we combined our skill set, and then we started to take on some of the harder orthopedic cases out here. But despite all that, the bone health was always in the background, always in my mind ever since I did that research at Boston University. I always knew that I was going to be coming back to it. I found that, that experience and all the research that I'd done, it was I don't want to say interesting because it's quite shocking and quite scary to see what's actually happening. But I always had a feeling that things would come full circle. So here we are now, because we're now, we've developed this training program for our clients and now starting to see some positive results. So again, I just wanted to kind of share how we got to this point where we are talking about bone health and where we are as we stand as a clinic. Okay. Um, Want to be clear about what today is. This is not, we just want people to just relax and just take this in. We have no agenda. We have no pitch. We don't have a quick fix program. We do not have a diet, hormone, nutrition program. We do not have a sales pitch. We do not have a program to sell you today. What you are going to get today is our program. This is the exact breakdown of what we do for our clients, and we're just kind of giving it away for everyone just to just be clear about what we're doing. All we're doing is share what we know, clinically, honestly, and just everything that we know. We want to give people a foundation for navigating a very complex topic, one that deserves more than a 3-minute clip on Instagram or just a quick answer that we cannot provide sometimes through email and on social media. And this is hopefully the start of something bigger as we continue to do more content, as we do more research, as we hopefully get more case studies or just more information. These are things that we want to be able to share with you guys over a long period of time. So that's where we are. Okay, so first thing we're going to do, is we're going to just go over briefly bone physiology, just so everyone's on the same page about what is actually going on, what is osteoporosis, and why are we doing the things that we're doing now. Okay, so obviously, bone loss is not just a number on a scan. The issue with osteoporosis and the diagnosis is fracture. As your bones become, as you have less bone, they become more susceptible to fracture. And, fracture is just, a fall and a fracture is just one of the most, it's one of the things that we try to avoid. Back when I was a student at Beth Israel Deaconess Medical Hospital, seeing people, fall and break their hip, have to go to rehab, it's just one of the most, traumatic things that, we don't want people to ever have to do, but we want to let people know this is a reality and people need to be, aware and prepared for things of this nature, especially as you reach a certain age. Okay. Um, 20 to 30% of hip fracture patients never return to their prior level of independence. And a lot of these vertebral fractures that people have are actually silent. There's no fall, there's no incident. So again, these things are quite serious and we take them again very seriously. But on the other side of the spectrum, there is a world where we can actually start to change things. And this is what we want to talk about today. We don't want to just sit here and just be, fearful of things. We want to try to see some opportunity. We want to see some things that we can actually be, proactive about and actually do to try to improve the ability for us to just live a good quality of life. So strong bones it's not just about avoiding fractures. If you do things that it requires to build stronger bones, you will have stronger muscles. You have better brain and neurological health. You'll have better metabolic health. Your posture will be better. Your breathing will be better. You'll have greater longevity. You'll have greater independence. So this is not just a thing where we just want to, just focus only on your T-score. We want to be able to look to see at what strength training as a whole can do for all of these aspects of life. Again, T-score is important, but there's so many other things that, proper strength training regimen can do for your entire just overall physiology and your quality of life. Could spend an entire semester on this stuff. We're going to try to get through as fast as possible. Okay. First, most important thing, bone is not static tissue. Bone is living tissue. Most people think that bone is like concrete. It is not. It is living tissue, just like your skin, just like your muscle, just like your blood. It is constantly remodeling itself and it responds to various signals that you put on your body. Okay. This is the some of the physiology of what happens to bone, and we just want people to be understanding of three very important cell players. So we have this giant red blob. This is something known as an osteoclast. Osteoclast is a cell that's responsible for breaking down old bone tissue. Right? We have an osteocyte, which lives within your lacuna. And these osteocytes have all these various sensors on it. So it can sense when there's load. It can sense when there's absence of load. And it can kind of trigger this mechanism where then these osteoblasts start to come in and then create and lay down new bone tissue over the osteoclast that is constantly eating up the old bone tissue. Okay. Um, let's continue. Now, what's one of the most important things that we want people to understand is that bone adapts to the load that you place on it. This is observed by a physiologist known as Julius Wolff, who observed that bone tissue reorganizes its internal architecture in response to mechanical forces. So if you stress your bone, it will grow denser and stronger. If you remove that stress, it will get weaker and thinner and start to lose density over time. All right, this is not theory. This is observable, measurable, repeatable biology and physiology. This is a law that we know is true. All right, we'll skip over this today. And we observed this when we started to watch astronauts in space. So astronauts, even very strong and very in their prime, people in the 30s would come back after spending a couple months in space and realize that they'd lost a lot of muscle, they had lost a lot of bone because of the lack of the ground reaction forces on their body. So the absence of stress started to trigger this loss of bone. But if you compare that to like a Muay Thai fighter, right? Someone that is, kicking trees and kicking, things at a very early age. They have very thick and very dense bones. And why don't we just show this? We'll just show this. Why not? Right. I know sometimes the audio doesn't come through on the webinar, but this is a lady. kicking down a banana tree. Do not want to mess with her. That is Wolf's Law in action. She started kicking trees when she was 4, so that by the time she's like in her 20s, she's able to kick down a banana tree just with her shin. Unbelievable. Would not want to mess with her. Okay. So, why are we all here? Osteoporosis. So, what is this condition? How does this happen? All right, because as we said, we have a couple players. We have resorption, we have osteoclast, we have osteoblast. When the scale is balanced, you have equal bone turnover. You have nice, healthy bone. Something seems to happen post-menopause as estrogen declines. Estrogen seems to be some type of mechanism that keeps this balance in check. So as estrogen declines, you have more resorption, you have formation, and then the bone starts to thin out. And then as you start to lose even more estrogen, you get even more formation, more resorption, less formation, and then the bones start to become very weak and thinner over time. Okay, so this is what happens. Reach a certain point, hormones decline, something happens within the bony tissue, which creates an imbalance of resorption versus formation. You get bone loss. But the problem is, here's what most people are told when they reach a certain age. Well, just walk more, take calcium and vitamin D, maybe consider medication, fosamax, prolia, discuss with your doctor. All very reasonable, but none of them look at the complete picture. Okay. Is walking really enough? Walking is good for you, but for the research says for bone density specifically, there is an insufficient mechanical strain for most people to trigger Wolff's Law, will actually trigger more bone growth. Okay. Again, just to be clear, I went over all this on the first webinar, so I'm just kind of breeze through for the newcomer. So if you want a more in-depth breakdown, check out our social media for the old webinar. Okay, because there's a lot of new stuff we want to get over. But calcium and vitamin D are essential, but these are like your building materials. But if there's no builder, it's like having a bunch of, again, building materials in front of a house, but no one's actually building. So you're not getting the workers to work. So the calcium and D is vitamin D just sitting there like kind of wood and concrete, but there's no construction happening. So again, you need construction materials, but you also need a mechanism and a trigger to actually bring those materials to use. Okay. So without the load signal, the body just doesn't know what to do with the calcium and the vitamin D. Sorry guys, I have this like automatic light that if I don't move after like 10 minutes, this thing goes off. So I apologize for some frequent little breaks like that. All right, so what is the solution? We know bone is living tissue that responds to load. We know what happens when that load disappears. We know calcium and vitamin D and gentle exercise are not enough. So what are they told to do next? So let's talk about that. Pharmacology. We're going to go over this a little bit in depth because we get a lot of questions on this. So we want to make sure that we're clear, and we'll start to get into some more exercises later. But this is a very, very important slide because we get a lot of questions about pharmacology. But before we go any further, I'm a physical therapist. I'm not a physician. I cannot prescribe medication. I will not tell you what you should or should not do, or what you should or should not take. I want to be clear about that. I will never try to. What I'm going to do is share with you how I personally think about these medications clinically, because when I'm working with a patient who is on fosamax or coming off of prolia or want to do or go without it, I have to understand the physiology to some degree because I work with you guys. So I'm just giving you my interpretation and my understanding of what I would do consulting with some of you who want to take it, who don't want to take it. So I feel that I do need to know a bit about it. So I'm going to share with you guys what I know about these drugs. Plus, combine the fact that I spent 2 years of my life in BU researching this stuff. So this is not coming from just a random place. I do believe I do have some knowledge about it, and I do think that this is a worthwhile thing for me to be able to share with you guys. So I want to be very clear about that. All right. So what follows is my understanding of the pharmacology based on publicly available research. I'm not making anything up. Plus, again, the research that I did, and again, my direct clinical experience now working with you guys. Please bring any questions about specific medications to your physician. They will know your medical history. I do not. This is not medical advice. This is just my clinical perspective. So I just want everyone to be clear about that. Okay. So just a little bit. So my clinical background research, I did a case review and I did some research on again atypical femur fractures that would happen. So when I was a student at Beth Israel Medical Deaconess Hospital, I was a student in the orthopedic trauma unit, and I saw in one summer two patients in person who had come into the hospital because they had broken their femur. And what they revealed was that both of these clients or both of these patients, and then two others that I actually did some kind of digging into the chart, were all had all suffered a very similar break, which was a clean, what we call a transverse break across the femur bone, which is the thickest bone in the body, right? And all of these patients were on fosamax for about 5+ years. Okay. And this was when people started to think, hey, what is going on? Why are all these patients that potentially are on this drug, why are they all coming in with the same fracture? And the thing about these fractures that really kind of really got to me was the fact that they all came out of nowhere. They did not happen from a fall. They did not happen from trauma. They did not happen when they, again, were in a car accident or slipped. These happened with women who were just literally stepping off of a curb, stepping down a step, and their leg literally just snapped in half without any prior warning. And the thing that really gave me pause and why I started to do more research, because one patient in particular, she was 69, had a, again, right subtrochanteric fracture in the femur. Leg gave out after going down a step. X-rays revealed femoral cortical thickening, transverse orientation, and presence of a medial spike. And these are all the characteristics of a atypical fracture of the femur, potentially due to long-term bisphosphonate use. And the thing that really got to me was the fact that this lady had been getting physical therapy for months from a diagnosis of sciatica from her physician. Her doctor, because she had leg pain, right? She had leg pain that was diagnosed as sciatica. So she was getting physical therapy treatment. Um, she was getting she was doing exercises, she was getting stretches done, all because people thought that she had sciatica. What she actually had was a stress fracture that was building up in her leg, and that was what we believe was actually causing her pain. Right? One of the other ladies that we saw who came in with a very similar fracture, um, actually they x-rayed her other leg and they found a presence of a stress fracture on her other leg. So while she was in the hospital, getting recovery from this first fracture, she had to have a rod put up in her other leg just to prevent a future fracture from happening in the first place. All right, so these were the case studies I saw in person. Again, I decided to do my research on that. Okay, so let me be clear about my understanding and where this came from. All right. Again, there's a lot of different drugs on the market. We have anti-resorptives, the bisphosphonates, fosamax, prolia, Boniva. We have the anabolics, Forteo, and then some of these newer ones on the market, Evenity. And these are all under active research. And again, I know things are changing a little bit. I don't want to talk too much about that, but there's still a huge market. There's still a lot of people who are actively taking the fosamaxes. They're being prescribed at Prolia and things like that. So I do want to spend a little bit of time talking about this anti-resorptive classification of drugs. All right, spend 3 hours on this alone. Try not to do that because we have a lot of exercise that we want to cover. Okay. All right, so here's how bisphosphonates work. Um, Again, you have a situation where you have more resorption than formation. That is osteoporosis. Bisphosphonates come in. So here's the little fosamax, little cells. They come in and they bind to the osteoclast. When the osteoclast encounters or absorbs the fosamax, osteoclast goes away, and then it starts to shrink. But then you have these osteoblasts that are the layers, so they all start to lay more bone on top of the bone that's not there. So again, because there's no osteoclast kind of eating up the bone tissue, you get this constant layering of new bone tissue on, and then you just get all this new bone tissue. So that's why when you take these drugs, you get a DEXA scan, you're going to see a huge spike in your bone mineral density because you just have more bone tissue. So that is the mechanism in how they work. All right. But it doesn't tell the whole story. Because here's what happens over a long period of time. All right. Osteoclasts exist for a reason. Osteoclasts eat up older bone tissue. So what happens is if you stop these osteoclasts from working, you will get a layering of new bone tissue on top of old bone tissue. But that's not supposed to happen because old bone tissue is not as strong, is not as viable. All right. So again, you have this layering of new bone tissue on top of old bone tissue, and then very soon you get this splintering action that happens in between, underneath your bones in ways that you may not be able to see or be able to feel. And then what happens over time is that what people don't realize is that this is a coupled mechanism, meaning that osteoclast and osteoblast kind of work together. So over time, as you have a suppression of osteoclast function, you also have a suppression of osteoblast function. So then you don't even get the layering of the new bone tissue over time because the formation will start to drop with the resorption as well. And these are the mechanisms in which we believe will start to potentially cause a fracture or atypical fracture of the femur. All right. We also got a lot of questions about prolia. All right, so we're going to spend just a little bit of time just trying to unpack prolia because it's a similar drug in terms of the mechanism, in terms of suppressing osteoblasts, but how it works is slightly different. So let's try to unpack this, try to go over this. So when you have big osteoblasts, more resorption, then you have formation. And then you have the prolia comes in, and this is a different mechanism. It doesn't bind itself to the bone. What it's going to do, it's going to essentially bind itself to suppressing this thing called rankle. And rankle is connected to these cells that are osteoclast precursors. So the cells that then turn into osteoclasts, the prolia comes in and just kind of shuts that down. So you get this shrinking and this stopping of osteoclast function over time. So as we said, over time, you reduce the osteoclast function, osteoclasts get smaller, osteoblasts take over, and you get this huge sudden spike of new bone tissue growing. The issue is that this is all publicly available research. This is what they say, and this is what they do. Okay. So there is this thing with Prolia called the rebound effect. So when you again, you initially have this drug that stops the rankle, area and KL is blocked. So you have a suppression of osteoclast function. The problem is when you go off of it, it's almost like the brakes or the dam comes off, where you have, the second you go off it, you have this huge sudden spike of osteoclast function. So it's like they were just kind of held back behind this dam for all this time. The second you stop taking it, the osteoblasts just come rushing in. They start eating up bone tissue like crazy. And this is why and what happens is there is a window where people are then vulnerable because there's this huge sudden bone loss, this window of bone loss. And this is why, we hear people, 7 months after taking Prolia, their vertebrae just kind of broke. By the way, this fracture is supposed to bend the other way. This is not supposed to be an extension-based fracture. This is supposed to be a flexion-based fracture. I couldn't get the thing to design it that way. But this is what happens when you come off of Prolia is you get this sudden surge of osteoclast function, and the osteoblasts just are not sufficient to be able to kind of balance out the equation. All right, so that is something to be very cautious of when coming off of Prolia. And it's what they say, that you go on Prolia, you get this huge sudden spike of bone, but then once you come off of it, you then have to take something to then supplement it to prevent this, again, this sudden drop or the sudden surge and this kind of and creating this vulnerable window where you have this sudden surge of bone loss. So this is something that I, as a clinician, have to be very, very cautious of if we are working with someone who is, potentially wants to do training with us and is like just coming off of this drug. Like this is something that I don't really have answers to whether or not it's safe, whether or not we should do it. So again, these are questions that I have is like when can we start to actually load people? Like what do they need to be on? Is it safe to start to do strength training for people, 7 months after coming off of this drug? I don't have the answers to that. But this is why we present some of this stuff. So hopefully we can get some more clarification, about the mechanisms of what people actually need to do to preserve the health of their bone. All right. My understanding of it, this may not be complete. If there are other people, pharmacologists, endocrinologists, researchers, I don't know too much about all this like cellular physiology. This is above my pay grade. I don't really know like molecular science at this level. Again, this is just my interpretation of just publicly available information that is here for everyone. All right. And so again, as a clinician that has to try to advise you guys or trying to just kind of help you guys figure this out, this is my current understanding of it. And that's what it is. Okay. That's my understanding of prolia. All right. Now, I just want to talk a little bit about just the efficacy of the drugs because again, I am not anti-medication. Again, I don't have any stance other than just stating what the research says and what is publicly available. And what we understand about things like this is back to a fosamax study. It looked at 3 years follow-up where they claimed that fosamax was able to prevent 149 hip fractures compared to two atypical femur fractures at the 3-year follow-up. The issue is, as we said in the previous slide, if you take these things for too long, then you start to get this mechanism where the bone just isn't turning over at a natural rate, and people are more prone to these atypical femur fractures. So at 10-year follow-up, the number of atypical femur fractures starts to significantly increase relative to the fractures are prevented. Right. So that's why they recommend that people go on a drug holiday and that there's a limit to how long you can be on these drugs. And this is very important because if you're 62, at some point you're going to be 67. And if you're being offered these drugs at 62, these are things you need to think about in terms of the long term. Like, how is this going to affect you when you're 67, when you're 70, when you're 72? So again, these are just, I think, conversations that people need to have just based off of, again, publicly available research and understanding the mechanisms of what these drugs actually do. Okay. Again, these are just sharing what I know. All right, these are decisions that you will ultimately have to make between you and your prescribing physician. All right, I'm just sharing what I know. But I will say this: if anyone who has been on these drugs for any period of time, if you have any signs of thigh pain or groin pain or leg pain, you don't know what is potentially causing it, you must get an X-ray to make sure you do not have a stress fracture that could potentially be, waiting to happen. It's very clear in the research that prodromal thigh pain or just thigh pain that is just kind of coming out of nowhere is a likely precursor to potential stress fracture. And generally decisions are made whether or not to prophylactically fixate that leg before it eventually gives out. All right. So anyone have thigh pain has been on these drugs, go get an X-ray. Better safe than sorry. Right. So I believe that we can say that with a high degree of certainty. Jaw pain or delayed healing after dental work. Osteonecrosis of the jaw is another huge one. They say it's rare, it's serious complication. And they sometimes need to have part of your fibula bone inserted into your jaw. It's just a big old mess. Again, I haven't dug too much into the research on the dental osteonecrosis of the jaw incidence rates. They say it's rare, but again, this is something that can happen. Okay. All right, so we're going to skip a little bit. All right, so we've gone over osteoporosis, we've gone over pharmacology, we've gone over some mechanisms. Now let's start to look into why we're all here. The research about natural bone growth. If people are hesitant to go on these drugs, they need to have an alternative. So this is what the research says about things like strength and resistance training, and that's why we're all here. Sorry about this. I lost my Zoom. Okay, so we want to hopefully leverage our body's own mechanisms to build bone. Right, we talked about Wolff's Law earlier. This is what we've been building up to, that we have this internal mechanism called Wolff's Law. If we stress our bones, then bone can grow. There's also potential for HRT, automized scope. Again, I don't prescribe this stuff, but I am, definitely in the space enough to know that if estrogen is one of the key mechanisms that creates, bone resorption to increase, then HRT may be one of those things to help suppress that. Automized scope, I can't really answer any questions about it, but I'm just stating it because it's something that's real, it's out there, and there's a lot of conversation happening around it right now. We have some long-term studies, EFOPS, which is a 16-year collection of data, longest running exercise trial for bone health ever concluded. And it concluded that progressive resistance and impact exercise halted and reversed bone loss in some cases. Benefits extended to strength, fall reduction, and fracture outcomes. Cool. O'Brien, 2022, which is a systematic review. One of the higher levels of evidence showed that progressive resistance training simultaneously increases muscle strength and bone density in older adults. They said the optimum dose was 3 times a week, 75 to 80% of one rep max with weight bearing and impact loading. Zhao in 2025 also was a meta-analysis systematic review. Again, tier A research study. Resistance training has a statistically impact on total hip bone density in postmenopausal women. But then there's a study that gets all the attention because this was the most well-designed, rigorously supervised, and produced results that were genuinely groundbreaking, called the Lift More study. So we can spend a little bit of time talking about Lift More. Lift More study was a study called the Lifting Intervention for Training Muscle and Osteoporosis Rehabilitation. It looked at postmenopausal women over 58 with low bone mass. It lasted for 8 months. They trained twice weekly, 30 minutes per session. Sessions were fully supervised, maximum 8 participants per instructor. We had a high intense resistance interval training group, 49 women, versus a low intensity home program, 52 women, published in the Journal of Bone and Mineral Research in 2018. Why it earned attention before Lift More, the conventional wisdom was, as we said earlier, was that high intensity training was too dangerous for women with osteoporosis because they say the bones are weak. The fear of fracture kept this population in a very light, low load walk, do yoga, do safe exercise. We don't want to hurt your bones. Let's not stress them too much. But as we know now, walking and things like that just do not cross a minimum level of stress to actually trigger bone formation. All right, so Lift More started to challenge that assumption directly and backed it up with very rigorous data. So this is what they actually did, right? So they did heavy exercises. They did a deadlift, 85% of one rep max. All right. So the deadlift, they did a back squat with a barbell. They did an overhead press, upper body pushing, lowers the spine directly down axially. They also did a jumping chin up. So people they couldn't do a pull up, so they had to jump up and do a chin up, and they kind of drop down and just kind of land on their legs. And these were the 4 exercises that comprised the study. Looking at the data, again, we saw some pretty interesting things. First off, the red is the low intensity group, people that did low intensity exercise, and the green is the Lift More group, the people that actually did the heavy weightlifting. Over an 8-month period, lumbar spine bone mineral density showed a average increase of plus 2.9% compared to a negative 1.2% bone loss. So the people that were on the low intensity program, the thing that stuck out to me is the fact that they were losing ground. They were losing bone, just doing gentle exercises, compared to the people that were lifting heavy were actually showing signs of actually gaining bone mineral density. Femoral neck, gain not as much, but 2% loss within 8 months doing low impact exercise. Something to definitely look out for. I made a little bit of an error. This femoral neck cortical thickness was actually a plus 6.3 gain, was not a negative 6.3 loss, but it was still a 7.3 point difference. All these findings were statistically different. So again, this meant something. This was a very meaningful study with regards to not necessarily a huge formation of gain, but a definite stopping of potential loss and then some gain. All right, so it's very important to recognize. So the study was groundbreaking, narrative changing, and just absolutely amazing. But there's something very important about the study that we need to talk about, and this is something that we're going to talk about. Again, the study moved the needle. It gave the clinical world the data it needed to say with confidence that high intense loading is not only possible for women with osteoporosis, it is beneficial. It gave us a scientific permission to do what good clinicians had already suspected, that controlled progressive loading is protective. It's not dangerous. It protects you. You need to do it. The problem is, of the 568 women who signed up, 162 dropped out after screening even began. Again, I'm going to do more work to make sure I get this accurate and clear. I don't want to make any claims. I didn't participate in the study. But from my understanding, only 101 people made it through clearance to actually got cleared to actually participate in the study. The people that were excluded had musculoskeletal issues, cardiovascular condition, they were on certain medications, potential fracture history, or cognitive impairment. So that's 82% of the women who want to participate in the study were excluded, and that is not a small number. And that echoes what I see in our clinic, where a lot of people that we see, 60 plus, have a musculoskeletal condition, they have a cardiovascular condition, they're on certain medications, and they're just not in a position where they are ready to start doing back squats, deadlifts, overhead presses. So what we're trying to do today is to help you guys figure out if you guys are in that 80% and can't really medically do these exercises, what we can do to help you get to that point. Or if you are at that point, what to do to make sure that you're doing so safely to de-risk the chances of you getting hurt. All right. So the research in Lift More proved the what to do. All right. It proved what to do is high intensity loading is safe for osteoporotic women when properly supervised. It produces meaningful bone mineral density improvements at the sites that matter the most. The fear of fracture was overstated because no one that was lifting the weights showed any signs of fracture. And then, brief 30-minute sessions twice a week were enough to drive significant adaptation. What it could not answer is how do you apply this to 82% of the people that are out there that want to be able to do these things, but they can't really do that? How do you maybe potentially regress some of these harder movements for someone with a bad back, a bad hip, chronic pain, and things of that nature? And how do you find the right starting point for each individual? And how do you progress safely when old injuries kind of change everything? And that's exactly what we're going to be talking about next. So another thing I want to talk about is, so we've been having conversations with a lot of people, obviously around social media. Some of you guys see us commenting on a lot of different posts. We get a lot of emails. We try to answer the emails as much as we can. And what we have gathered is there are essentially three groups of people that we are talking about simultaneously. And that's what makes doing content very challenging because these are three very distinct groups who are all at different stages of their bone building osteoporosis journey. All right. And again, comes from real conversations we're having right now with people all the world. People that are coming off cancer drugs, people that have, significantly low T-scores, some people who are, lifting weights and deadlifting, want to make sure they're doing it right. We have some people who have had a fracture, they're a lot older, they're more frail, have more balance issues. And this echoes what we see here in the clinic. This distribution is the distribution of what we see here. We have some people who are doing some higher level stuff. We have some people who are doing some of the more kind of balance, more independence, more just kind of daily active living. And then we have a lot of people in the middle who are recovering some type of pain or injury, who maybe want to get to that level, or who definitely want to prevent kind of slipping back into that more kind of sedentary, frail kind of lack of balance level. All right. So we have to figure out, who's this right for? Who is like aggressive strength bone loading? Who is it right for? And how do we know who it's right for? All right. So again, we have different groups. We have the group one, the upper 20%, the lift more ready, relatively healthy, no major musculoskeletal, limitations, clear for loading. All right. These are the people who are deadlifting, who are doing squats, who are jumping around, who are doing impact work. So we want to make sure that we have a program for people who are at this level. We have that 60% in the middle, who is probably the majority of our practice, got something going on, a bad knee, back pain, haven't exercised in a while, maybe have been a little sedentary, and then this diagnosis kind of just caught you off guard, and you're trying to scramble to try to do all these things. People who are screened out of lift more, right? We have to understand you still have to do these things. We just have a different starting point, and we probably don't want you to start putting dumbbells or barbells on your back day one if you're kind of in this middle group. And then we have our other 20%, group three, who are the medically complex, people who have more advanced frailty, they have significant comorbidities, more severe osteoporosis, potential with fracture history, major surgical history. These are people who we just need to be very, very cautious of advising. And these are the people that I worry about the most when we start posting content of some of our clients, like swinging kettlebells, doing deadlifts, like doing all these things, doing full goblet squats. I worry about this group. I don't want people in this group to think that they need to be doing stuff at the level one. Right? Again, we have three very, very different and distinct groups here. So that's what makes content very challenging. So that's why we do these very long webinars to try to give you guys context for like, what we're trying to do and the types of groups that we're trying to speak to people. All right. So some of the stuff that we post gets taken out of context because we're speaking to this group. And sometimes it gets taken out of context because we're speaking to this group. And sometimes we're speaking to this group. So that's what makes the content game kind of challenging, but that's kind of where we stand. This is just what it is. And obviously putting stuff out there, we are here to just answer questions and potentially take criticism when it's warranted, or just to be able to prove our or just kind of state our positions in terms of where we stand for this type of stuff. All right. So we want everyone just for a second, because we like doing this just to help me understand where you guys are at. Where do you feel you are today in terms of the groups? Do you feel like you're in group one? You're ready to go, ready to start, doing strength training, start to go heavy? Or do you feel like you're in that kind of middle 60% where you have just a thing going on, you want to do group one, but you're just have issues? Or if you are in group three, just, there's other stuff going on that definitely takes more a precedent than doing heavy stuff. Yeah, group two, group one, a lot of group twos, a lot of group twos coming in. Group three, two, two, two. Yeah, this is, and it's if we did a poll, right? I don't know how to do a poll. I'll do it next time. We're gonna see this. We're gonna see the 80-20 curve. We're gonna see 20% of you guys, maybe 40%, maybe 30% of the one, because I think that you guys see the content of us doing the more advanced stuff. So I think that we're definitely attracting more of the people in group one who want to do the kettlebell swings, want to do the squats. One or two not sure. Yeah, and that's again, we're gonna try to give you guys a good kind of starting point to help you guys identify what level you guys are actually at. Upper two have scoliosis. Yeah, group two until it's Wednesday. Now group three through the back out. Like group two, vast majority of group two. I'd say, yeah, 60% group two. I'm seeing probably 30% group one and 10% group three. All right. Again, we want to make sure we have something for everyone today. But what I've always suspected is that the vast majority of people are in group two. Again, what group of scoliosis? That is just one. We always try to help people understand that is just one piece of the pie. That is one factor, and it's a big factor. But there are people who lift very, very heavy weights all day, every day, who have major scoliosis of their spine. Doesn't mean it's right for you. It just means that that's something that needs to be worked around, needs to be assessed, and needs a very, very careful, just clinical approach in terms of what feels right, what feels wrong, what your spine and your body cannot handle. All right. So again, these are the this is what was going on, right? And again, this is why we like to have an idea of kind of where people are at. Darlene, 1.5, 30 weeks out from a calcaneus avulsion fracture. Yes, yes, stuff like this. We're going to be spending a lot of time talking about injuries, right? Injuries with training. This is why I want people to know when we post more of the our clients like Pam or Julie, they're doing the stuff that really gets people attention. They're jumping, they're doing impact, they're doing kettlebell swings. Every time I press upload, I hesitate. I don't particularly like doing it because I know that there's someone that has gotten injured doing these things. It is possible where someone can do a kettlebell swing when they weren't ready, they did it incorrectly, it could cause a fracture. It is possible that someone starts doing heel slams or starts doing impact drills and it flares up, plantar fasciitis. It strains a calf. It creates an avulsion fracture of the Achilles off of the calcaneus. All right. So, but the problem is when we post just general kind of basic rehab stuff, it doesn't really it doesn't get to you guys. So it's only when we post the higher level things that it actually gets people attention. I think I understand why, but we yeah, inspiration for sure, and I will continue to do it. Like I am not. I'm just saying I have hesitancy. I will do it, and I will do it gladly because I think it is inspiring for you guys to be able to see what is possible. But that's why all of our comments right now, all of our descriptions, they're all just disclaimers because we don't want anyone to take what we're saying out of context. Darn algorithm. Yep, we're going to talk about the algorithm for sure in a little bit. But it is what it is. It is what it is, and it's not going anywhere, right? And it's helping us find you guys. Oops, microphone lost. Can you hear me guys now? My mic got unplugged. Am I good? Audio? Webcam got messed up too. Give me a second, guys. I gotta reorient myself. 1 second, please. Okay, we're back. The most important thing is that people have an understanding of where their starting point really is. And we're going to be spending the rest of the time just talking about exactly what that means. Okay. All right. So all good. Let's continue. No matter which group you're in right now, our message is there is a path forward, regardless if you are at stage 3 or level 3, level 2, or level 1. There is always a path forward. Some of you guys have you guys seen Carol, the lady that does her little step and balance drill on our social media? Right? She's level 3. She fell a little while back. She's not doing back squats. She's not doing heavy deadlifts or kettlebell swings. But do we not see that there's a path forward for her to improve her balance, her strength, her independence, right? So there's a path forward for everyone. In that even if back squats isn't something that is going to be reasonable for you, that doesn't mean you don't find a place where you're at and try to make progress. And that is going to be the main message that we want to get across, and that we're going to try to show people the path forward, regardless of what group you're in, what that next step looks like for you. If you're at the higher level, if you're at a lower level, there's always a path forward. And that is the main message that we want people to, that's the main message we want to get across today. There is absolutely a path forward no matter where you're starting from. Sorry about that. I didn't know the chat was on the screen. I thought only I could see that. It is not off. Or not. Oops. What the heck? Exit out. All right. So how did we all get here? Right. I've done a lot of thinking about why we're all here today. Like, how did this all happen? Why are people here with us on a Saturday? Why have 1,000 people sign up for this webinar? Why are we actually doing this today? How did we get here today? From my understanding, from my conversations that's happening with you guys, it starts when you have a visit with a doctor. Usually starts with the 65-year-old. You have a DEXA scan, typically the first one. You sit down, get the results, you get the diagnosis, and then they have a plan. Some of you guys have said there's like a folder sitting with like prolia and fosamax, behind the doctor, and they say take the medications. And then you ask side effects and say, no, they're rare. Don't worry about it. And if you don't take these things, you're gonna fall, you're gonna fracture, and then that's it. Take some calcium, go take some vitamin D and go for a walk. And that's, from my understanding, from what you guys tell me, that is the plan. That is the medical plan for this condition that you guys are leaving with. The problem is, in today's world, we believe the phone probably understands that you just had a conversation with the doctor, or you're starting to search side effects, you're starting to do your own research. We have a lot of more information available to us. We have AI, we have Google, we have all these things at our disposal. We have a whole generation of people that took these drugs. We have all this research saying, the mechanisms. So people do their own research now, especially before they start taking, drugs and medications. They do their own research. Algorithm knows you guys are having these conversations. The algorithm knows you guys are researching this stuff. So when the algorithm understands what you guys are looking for, the feed is going to flood with all of the information. Lift heavy. You got to do hormone therapy. You got to completely overhaul your diet. You got to start getting weighted vests. You got to get the vibration plate. PMF. You got to start jumping around. You got to do a full strength program, maybe like ours. But you're getting this all at once with zero sequencing and zero context for who's ready for this type of stuff, who you're not ready for, and that's going to lead to some issues. Okay. So here we are today. I should start showing up in you guys' algorithm, posting our stuff just a couple months ago. So here we are. All right. So you get a diagnosis with a very thin plan, an algorithm that knows what's going on. You have a feed that is just flooded with no shortage of opinions and what you need to do. All right. The reason why we do these long webinars is so we can state our full position, state who we are, what we do, how we help, have no interest in sharing with you guys anything that we don't know. All right. And we're just sharing what we do know. So you have all these forces colliding at once, and that collision is, I think, why you guys are all today. And this is way different than it was 10, 15 years ago. So here's how we want to help people understand what is actually going on so that people can start to psychologically orient themselves beyond, if there's anxiety, if there's confusion. A lot of people, you guys are saying you guys are panicked. This diagnosis just comes out to you out of left field. People feel, again, these are the exact words, like terrified, horrified. It's just a really scary thing. And what's really happening is we're all playing a very weird game, whether you signed up for it or not. We are all playing a very strange game. And I'm saying this not to trivialize what's going on, what people are going through, not even a little bit. We are trying to frame this so that people have an understanding of what is actually happening. And seeing it this way will start to give you some control over what needs to happen next. So what does it mean? How do we know we're playing a game? Well, what do all games have? A winner, a loser, some rewards, some punishments, all true. What do almost all games have in common? Almost no exceptions. A score, right? And the score we're all playing is this thing called a T-score, right? Can we all acknowledge that we're playing this game about this T-score, and people are, this is just this number is just really starting to, I don't want to say like mess with people, but it's on people's minds, right? And the T-score is the score your DEXA scan gives you, and it's quietly becoming the thing you're trying to change and obsessing over to some people. And I get why. It's scary, right? So we start to understand that you're playing this game, trying to do things to our body to try to increase a score or try to prevent a score from decreasing. And it's affecting people. We get emails, we get DMs, you're here on the Saturday, right? You could be doing something else. You're listening to this, random guy in California, talk about this stuff. So it's clearly having an effect, and we want to make sure that we, again, give people a good, solid psychological framing to understand what's actually going on. And I think people are almost being forced to play, whether we signed up for it or not. So the real question isn't whether or not you're playing this game, is whether or not we know the rules and we have a groundwork for understanding what we're trying to do to maybe try to win at this game. Again, not trying to say this to trivialize and turn this into a game, but it's literally a score. You do things and make score go up. You do bad things and score goes down. So it's literally what's happening. And it's not very subtle, is it? Conversations we have with people in clinic, through email, direct messages, like there's a lot of pressure for people to be, taking drugs without any full real discussion. And then online now, the message is just as loud in the other direction. You better start going to the gym and start doing deadlifts right now. You can start jumping and stomping, or you'll fracture a hip and end up in the hospital. So it's coming from both angles. Take the drugs or lift very heavy. And those are two opposite ends of the spectrum. We're trying to figure out how to get people maybe to a more natural standpoint, but we want people to understand, like, these are two opposite ends of a spectrum. All right. And before we go any further, I'm going to be very, very blunt and very honest with people. I'm not entirely comfortable being like the only one like talking about this, right? The stakes are very, very real. I believe this is genuinely new territory. The research has come a very, very, very long way. And I would say that nobody has it fully figured out. I think that some people have it more figured out than others. Definitely, the team down in Australia, Belinda Black, Liftmore, they're way ahead of the game. All right. The old model is very simple. Take the meds, don't question the doctor. And we've already talked about why that is an incomplete picture. So people are going to be playing this game regardless. All right. So here's what I can offer you guys. Structure, how I see it, some rules, and just a way to kind of make sense of what this is all happening. All right. So what are the stakes? All right. We got to take a step back, take a breath. Let's just take a big, honest picture of what is going on. because again, things are coming at people from all different angles. If you do nothing, your bone will weaken. You take the meds, maybe the right call for some people, but it's a temporary result. All right. Some of the new classifications I'm not up to date with. All right. I don't want to speak on things I don't know, but we're trying to help people find the middle path and just kind of what's right for people. Sometimes you may need to go on meds. Sometimes you may want to avoid it. Sometimes you want to maybe need to lift heavy. Maybe you need to go light. All right. Everyone's going to have a very specific path in regards to their situation. That is the hardest thing, and that there is no general path for every single person. All right. Called the game of bones. All right. You have a spine, you have a hip, you have medicine, you have weights, you have nutrition, you have scores, you have scans, you have molecular physiology, you have all these things hitting you guys at once. Research, YouTube, algorithms, do this, do that. It's just there's a lot of stuff going on. So we better just make sense of it all because we're doing it anyway, right? The game of bones, we're calling it. So if we're going to play, we're going to need to understand a couple of ground rules. We need to understand some guidelines. We need a comprehensive plan, not one that's just, taken from a 3-minute clip from Instagram, right? That's why we do these long webinars, because I know we're doing 3-minute clips on Instagram, but we want to make sure that people have something more comprehensive to execute on. And most importantly, we need to have a way if we're moving in the right direction and that the actions that you're taking today are actually having a meaningful impact on the health of your bones. All right. So what does it all mean? What do we need? All right. What is the title of this presentation, guys? The Strong Bones Blueprint. So here we are, a step-by-step plan for building stronger bones and a stronger life. So now we actually start the presentation for today. Hopefully that wasn't too long of an introduction. About an hour, not too bad. So before we get in, I want to take any questions about anything we've gone over so far. Now the webinar starts. So the first hour was just background. Right? Let's take some questions. Does it fit, guys? Is my understanding what's going on accurate? All right. Do people feel overwhelmed? Do people feel encouraged? Like this presentation might take 2.5, 3 hours, right? That's why we're gonna have a replay. This is gonna be long. We're gonna go really, really deep. The first part was just a recap. All right. Please give us if you guys just type into the chat. We're just gonna take a quick minute break. Just give us any specific any questions? Is it helpful, or do we feel like we're in the right place? We're not trying to trivialize this, but it is a game, right? Do you guys not see it? It's a score. You got to do things to make the score grow up. We will give replays to everyone. Don't worry, this is going to go long. I'll be sharing this on YouTube, guys. I'm going to share it to everyone. We'll post clips on social media too. Liftmore published MedX. I think they're doing one right now. I think I heard her on a podcast. She's doing one with Evenity, the drug, and they're going to try to do some stuff with that. She did a MedX trial, tested people on the drugs. We need a blueprint, guys. All right. We need a blueprint. If you have a blueprint to follow, it makes it a lot easier. All right. Yeah. So it seems like people are, it's a little technical. Yeah, I know. We have to be technical. I'd rather overwhelm than underwhelm, you know? We have to speak a level of a clinician level. I can't speak. I try to distill this stuff down to the basics for people to understand, but yeah, some of it's technical, right? But it's meaningful. All right. There are a lot of physical therapists out there that know how to load people safely. They may not be bone stimulating people, but I don't think that that is necessarily a thing that you actually need. You just need someone that knows how to load your joints safely and make sure that they can put you in a safe position. All right, so are we ready to get into the actual workshop for today? So the first hour again was just a precursor, a recap from the first, just to get everyone up to speed. Now we actually get to talk about some of this stuff. All right, let's continue. We all good? So how everything fits together. We need a framework. A blueprint needs a framework. A foundation of principles. Principles, these are non-negotiable truths of laws of physiology, of anatomy, of the way our bodies interact with this earth. Principles must be at the foundation of anything. We'll talk what this actually means. You need a strategy, a plan. So how these truths will apply to your situation. And then at the top, we have the tactics, the execution. These are the exercises. This is your sets. This is your reps. This is your recovery. We need all three. We cannot just have one or the other. You need the whole thing for it to be a very complete framework. So let's start with principles. The principles are the things that nobody sees. People, and this happens in all walks of life, in all areas of discipline, where people genuinely try to rush to tactics. They get a diagnosis of osteoporosis, they automatically think, what exercise do we need to do? How many sets? How many reps? How many weights? Those are all very important things, but that is going to live at the tactical level at the top. It is not the foundation in which a program like this is built on. So the principles need to happen first. And these are the non-negotiable truths. And with respect to bone loading, we need to know how bone actually responds to load and how the body will adapt to that load. You put the wrong load, something bad can happen, guys. This is serious stuff. Like if osteoporosis is your bones are like potentially like ready to fracture. And if you don't have a plan for loading, come on. This is the most important part, is the foundation. The foundation, the strategy and the plan gets built on. So we're going to spend a lot of time talking conceptually about the principles. We will have plenty of time for exercise at the end. We're going to go deep into that. We're going to spend a lot of time on principles first. This is the most important part. This is the foundation that gets built on. Strategy. How do we actually navigate the path to the stronger bones? What movements do you need? What order? Do you do presses? Do you do deadlifts? Do you do core exercises? Do you do basic stuff? Do you do balance? Do you do it all? Which one do you do first? Do you have pain? Do you have an injury? Some ladies, she said she has like an avulsion fracture of her calcaneus, her Achilles tendon, pulled the bone off of her heel. Think she's ready to start doing foot stomps and heel drops? No way. Overhead press. People we see with like shoulder impingement, rotator cuff strains. Like, do you know how many people in their 60s have like rotator cuff problems, just like shoulder problems? You can start doing overhead presses right away. Who's got back problems, right? You can start deadlifting right away. We want to, but we need to have a strategy to make sure we get people there safely without getting hurt. Get hurt, game over. Or a significant setback. So we have to absolutely prioritize no injuries or reduce the risk of injury to the smallest percentage possible. That's what we're going to be talking about. Strategy is a plan that adapts to each person, not a generic program. Every person's strategy is going to be very, very different from the next person. That's why I don't have a program of here are your 7 like workouts to do. It's going to work for some. It's not going to be for others. I may do some. We'll make very, very clear that this is for people at this level and this is for people at this level. We'll try to share things, but we want people to understand the context of the framework that in which we need to make these decisions to make sure that we put ourselves in the right position to succeed. Tactics, sets, reps, form. What are the cues that are going to keep you safe and effective during the exercise? This is where the principles and the strategy will get carried out, because you can have a good plan, but if you're just not executing the exercise correctly, you're doing the right thing. You're just doing it incorrectly. So we just have to figure out at what level we need to be, helping people. Principles, strategy, tactics. But tactics will only work because of the principles and the strategy that was developed underneath them. All right, are we all clear on the structure and the framework? Principle one. You guys have heard me say this is the most important one. Keep these principles in the top of your mind anytime you do any exercise for your bones. You have to be actively thinking about these things. This is what I do. We're working with clients. You guys see it on Instagram. We're not just having them exercise and just counting reps. We are watching every single joint, every single muscle, every single angle, every single adaptation pattern, because we want to make sure that their body is moving well before they move often and start to load. Keep this one. Keep these at the front of your mind every single time you exercise. Am I moving well? Quality of movement before quantity, always. This comes from Great Cook. Great Cook has to be one of the most influential people in my career, and thousands of the best physical therapists, athletic trainers, rehab professionals, chiropractors. This is the saying of their company, Functional Movement Systems, SFMA. I don't work for them. It's just I owe a great deal of where I got to in my career just due to this phrase and what this phrase actually means. So it does not matter how many sets or reps or workouts you do if the movement itself isn't sound. If you put quantity of load or reps on top of poor quality of movement, you're just going to keep repeating that same problem over and over again with load. So if you have an ankle problem, you're going to load that ankle with the things you guys are having to do. There's no way. But if we can try to get the ankle to start moving better, maybe we can start to load it and you'll start to get some more positive adaptations. Again, I didn't make this up. Great Cook and this team behind the Functional Movement Systems, SFMA. So when I mention guys, if I've told people in the past, where do I start? I need to find a clinician, find someone with an SFMA certification because they will understand this principle. They should. Not all of them apply it. We apply it as much to the best of our ability. But what this is a screening for how well you move before you start to move often, before you start to load. This is the number one thing that you must have in at least some understanding of is your movement quality before you start lifting weights. So what does it actually mean to move well? Number one, can your joints adapt? Moving well, number one, requires your joints to get into the right position to react and adapt to stress. Learned this phrase from a mentor by the name of Charlie Weingraf. This is very important. Your joints, your ankle needs to bend when you do a squat. Your knee needs to bend when you do a squat. Your hip needs to flex. Your spine needs to bend. Your spine needs to extend. If you do an overhead press, your shoulder needs to go up. Right? Your wrist needs to be able to bend backwards to do like a push-up. Your joints need to have the mobility to get into the right position to react positively to the stressors. A lot of people in their 60s have knee arthritis problems. You have an old foot or ankle injury. You have a tight hip, a shoulder that goes up higher than the other. That doesn't mean you can't exercise. It just means you better understand what that issue, how that is affecting the quality of your movement. Because sometimes the old ankle injury that you had 10 years ago isn't going to affect your ankle anymore. It's going to affect your knee when you do a squat. If your knee is more painful on one side than the other, when you do a squat, it's going to start to shift that load into the other side. Maybe you have a right left back injury if you have right knee stiffness. So this is what this principle means is the biomechanics of understanding mobility, form, and technique. This has to be at the foundation of anything you guys do, at least an understanding of it. You may not have to have a physical therapy degree, but you should at least have some level of understanding of what your bodies can and cannot do before you start to walk in the gym, start doing some of this stuff. All right. Next one, length, muscle length. Who's got tight muscles? Anyone got tight muscles? Anyone got like a tight hamstring, tight neck muscles, stiff back? Your muscles need to get long enough to get into the positions that the exercise that you're being told to do are going to demand. So part two of move well before move often. Again, part one was the joint mobility. Your joints need to move. Number two, your muscles need to have enough length and flexibility and pliability to be able to get into those positions. Because guess what, guys? Tight muscles pull your joints out of alignment. If I have a tight trap muscle in my neck, is that tightness is going to pull my neck down into my shoulder. It's going to create a little pinching right here. I do an overhead press, I'm going to pinch that neck and that potentially that nerve even more. So before I ever get to get good adaptations for my shoulder overhead press, I'm probably going to run into like a pinched nerve in my neck, like pain in my trap muscle. You guys ever felt that before? Tightness on the top of your trap? You know how painful that is and annoying that is? That is not something you want to be training through. We need to understand these things first, is what I'm trying to say. Not trying to scare you. I'm just saying this is how we prevent an injury, just acknowledging that these things exist. If the tissue can't lengthen, the joint never even has a fair chance to do its job. So maybe you have a really flexible joint, but the like your knee joint, for example, like we have people like in the clinic right now. It's pretty cool. Like we have them do the first squat. They get like a third of the way down, and they can't get any further. But then we test if their thigh muscle, their quad muscle is super tight. And we just do some stretching, some release of that quad to make the muscle longer. And all of a sudden, they're able to get into a much deeper squat just because we lengthened the rope, because we identified it first. We lengthened it. And then the quality of their movement has improved significantly just because of the fact that we will identify that there was a length issue that was compromising their mobility quality. Stability. Stability. So think big mover muscles like a bicep, your thigh muscles, those are called mover muscles. Every joint has also a set of very small, tiny muscles to keep the joint stable. The stabilizers are like the scaffolding for your body. Small, tiny little muscles between each joint. They keep you stable. Do you want to load something that's unstable? Does that make any sense to load an unstable foundation? Do we want to load tight muscles, unstable joints? No. Who would ever want to do that? But do you have any idea before you start to load, like how well you move? Do your joints get into the right position? How long or how tight your muscles are? How stable your joints are? I'm not trying to say this to add such a layer of complexity to make it more confusing for you guys, but these are the things that I think about before we start to put someone under a barbell or put someone in a position where they're about to do a kettlebell, deadlift, a squat, or a push. These are just things I think about. These are the questions that you need to be at least asking yourself. And if you don't know, this is why we have to encourage people to find someone that at least understands some of these principles at some level, so you have something to build on. So you're not just rushing to the gym, start doing home programs that you see without any understanding of your movement quality before you guys start. Is that clear? I think your strength. Sure. We're all trying to build strength. Strength is what's going to get us the stronger bones. But strength is built on this foundation of mobility, joint health, and stability. Strength, you load that foundation. If you load that foundation, nothing breaks, you will get stronger. You load that foundation, the foundation breaks, you will get injured. That's how they happen. We said earlier, the compensation chain. This is what we see all day, every day. This is like, yeah, we do the bone loading stuff, but we see move compensations. We will do 4-hour webinar just on this alone one of these days, just talking about movement compensations. If you guys want to know more, we can talk days on this stuff. How a stiff ankle changes how the knee tracks, how the knee that's bent inwards is going to change how your hip loads. how the hip load is going to affect how your spine loads. A shoulder that doesn't move well above head is going to show up like a tight, like lower back if you're trying to put something above your head. Going to create compensation in your neck. Body's always going to find ways to compensate. If you don't know what those compensation patterns are, that's where the injuries are going to build up. And it may not be in the area where you actually have pain. It may be coming from somewhere else. This is the hard part. This is the hard clinical stuff, guys. We'll do, if you guys want, we'll do 4 hours on this one of these days. And the reality, we're seeing some of you guys now. You guys are finding our clinic. And we've had a clinic for 8 years. And we know that the vast majority of the 55 plus population, you guys have something going on. I've got stuff going on. I'm not perfect either. I've got hip, shoulder, neck issues. Everyone's got something. Right? The reality is most people have something going on. Stiff joint, old injury, something that they've been avoiding, some little issue here and there. Right? That's not a reason to stop. It's just a reason to just take that one little thing seriously before you start to think about doing heavy loads at the gym because you saw someone at the gym or saw someone online telling you have to do it. Just hit pause, let's assess to see people's movement quality, and then we'll try to find a strategy to actually load. All right. Are you ready to load? As we said, before you walk into the gym, is your body truly ready to load? If you don't know the answer to that, find someone that can at least give you some answers. You don't need the complete picture. You don't need to be 100%. You don't need to be 100% moving well in all joints, have no pain. We're not saying that. You just need to be aware that that ankle that you have could cause issues if you're going to do squats. And maybe we modify certain things. Maybe we have you do other patterns first that don't involve the ankle. Maybe if you do have scoliosis or shoulders tightness, maybe we start doing some leg work. Maybe we start doing some asymmetrical loading, try to balance out your muscle patterns, right? Maybe we need to do some rehab work on that tight knee, quads all stiff, making your knee not be able to bend, causing asymmetrical load through your pelvis, causing strain on the other side of your back when you do a deadlift. Maybe you got to do some work, some stretching work, some roller work, some rehab work before you start to load up these movements. Right? You're not saying this again, I don't want to overcomplicate this, but this is just what needs to happen because we want people to at least be aware of it instead of just going and start doing things randomly without any acknowledgement of these things. All right. We've said strength is built on a foundation of mobility, flexibility, stability, and control. Skip the step. You're not building strength. You're building on top of a crack, top of a weak foundation. Move well first and then move often. That's the order that usually works. That was principle 1. Principle 2, strength is a skill. Strength is a skill. You do not just start lifting weights randomly, arbitrarily. Lifting weights and getting stronger is a skilled movement, just like it is learning how to walk, just like it is learning how to read and write and do math. Doing a squat is a skill, such as playing the piano, such as lifting a heavy kettlebell. Strength is a skill. It's a skilled movement. It's a skilled pattern. You don't just do strength, you learn strength. Said people are facing two opposite ends of the extremes. Doctors say do these pills, and you have other people saying do bone heavy loading activities and exercises. And I have the utmost amount of admiration and respect for some of these people that you see online. You guys see it, I see it too. They are really strong. And the things that they're doing are truly incredible and inspiring. That's why we like showing off our clients. We don't want to just sit here and just have people just sit there and be all upset about the complexity of their body and they're never going to be able to do it. We need people like this to inspire us, to show us what's possible. We just need a plan to help people get to that point so they don't get hurt along the way. That's all we're trying to say. And there is a middle ground. We absolutely firmly believe that helping people get stronger is the most viable solution for most people. But you can't just get stronger. You have to acquire the skill of learning to get stronger and what that takes. You see a ballet dancer, you don't just day one start doing ballet and start doing these things, right? A golf swing, right? I can't like watch a YouTube video if I've never golfed before and then take what I learned from the video and just start swinging professionally right away. That's not how anything works. Playing the piano. Yeah, I'm just typing keys with my fingers, but it's a motor skill that's learned and developed over a long period of time. How is doing a barbell deadlift any different than that? Are people approaching lifting weights with the same level of intent behind learning these things, like other skilled maneuvers? I hope not. I hope we take weightlifting to the same degree of seriousness as we take any other skill that we actually have to practice and learn and master before we start jumping in, start doing these things. Because it's about neuroscience, guys. It's not just about your joints and your muscles. Neuroscience, neurophysiology is what we're after, especially in this beginning phase where a lot of people are at. Or if you're already at that phase where you are lifting, want to make sure you're doing so with absolute, mastery of technique and form. You'll get greater results if you adopt these principles. Everything starts at the brain and the nervous system, not at the muscle and not at the bone. Brain and muscle are needed to build new connections. A lot of times pathways that don't even exist inside your nervous system yet. I can't start swinging a golf club, even though I may have the prerequisite level of strength, mobility, control my body. But if I don't have the neural wiring of how to sequence my muscles to work at a certain timing, frequency, the relaxation of other muscles, so that make sure my movement is nice and fluid and smooth. You're building connections in the beginning, guys. You're not just doing exercise. You are acquiring and developing neurophysiological patterns when you do these movements. And a lot of people, the people I see here doing this stuff right now, have muscles that have gone quiet because of poor posture, because they're sitting at a computer for 15, 20 years. They had this old injury that was never rehabbed to 100%, right? These or there's pain. There's knee injury, there's knee swelling that has, caused muscles to become weak. The neurological, pattern, the wiring from the brain to muscle has shut off because of pain. Let's shut off this phone. It keeps going off. Sorry about this, guys. Can't take any calls right now. This has happened uh, many, many times in just recent weeks. And I have nothing at all, negative to say about anyone that puts content out there in trying to help people give some type of plan or some type of path. But the reality is when people are trying to learn to do a deadlift with a dumbbell, watching something on YouTube, the the phrase that I keep hearing from people is something doesn't feel right. Something's off, and the person can sense it. They're like, I'm doing these exercises. I don't quite know if what I'm doing is right. Something feels off. All right. This is just the reality of what we see every day. They're doing exercises that see research backed, all makes sense. It's it all aligns the right way. It's just something's off. And the person can't quite explain what's off. They just know something's missing. They're doing this exercise. There's something not connecting. Because people don't know how to do exercise with the right form because you don't do an exercise with form. You feel your form. Form is not something you do. So form is something that you feel. Right? What I mean by that is form is that connection between brain, nervous system, and muscle muscle, nervous system, and brain. Form is based off of neuromuscular feedback loops. Your body talks to your brain senses things are off, it sends adjustments to muscles to correct the technique based off of what it interprets and understands as correct form or correct technique. If you do not know what to focus on, if you do not have the feeling of what the exercise is supposed to feel like, that's the thing that's missing. You're not getting the feel because you're not being told what to focus on or what it's supposed to feel like. People are jumping to bone health without having this understanding that these skilled lifts start at the neurophysiological, neuromuscular level. You don't just do exercise, you acquire it, you learn it, and you learn the feel. You learn how it's supposed to feel. Because when you learn how it's supposed to feel, you know how it's supposed to not feel. So when something's off in a deadlift, you can make that adjustment to make it right. Or if something feels right, and it's like, man, this feels really good, your brain starts to learn that this is how it's supposed to feel. Does this make sense, everyone? Form is not something you don't just do an exercise with good form. It's something that you learn to acquire. It's a feeling, a neuromuscular, neurophysiological thing that you acquire through practice, through repetition, through feedback. It's not something you just walk in and start doing if you don't know what you're doing. It's like me going to the golf club, the golf range, start hacking like golf balls without any instruction. It's the same thing. It's just the stakes are a lot higher. You're loading like osteoporotic bone. And if you don't know this, and this is how people get hurt. You acquire form. You don't just do it. How do you acquire it? There are stages of motor learning. This comes from our kinesiology background, Penn State. Just understanding that this is not something that's just people take this stuff for granted. They think exercise is just something you do. You go to a class, you move your body around, you get some endorphins, you burn some calories, you break a sweat, you feel a little sore, and that's it. Not how we approach it, not even close. Stage one, unconscious incompetence. This is where a lot of beginners are going to be at. Everything feels foreign. You can't feel anything here. You're not even aware of the things that you don't even know. Better be aware of what stage you're in before you start doing things that require some level of proficiency and technique under load. As you improve, you then become aware of the incompetence that you have, right? You're now aware of what's missing. Oh, I can't feel my lat when I do a press. Oh, I can't feel my glute activate when I do a bridge. It might be frustrating, but at least you're aware of it now. You can feel what's off. You can feel what's missing. You're aware. That awareness means that you're starting to grow very slow but very meaningful connections between brain and body, body and brain. These connections take a little while to form. You don't just get them right off the bat. When you start paying attention to your body when you exercise, instead of just doing exercise, you're actually starting to feel what muscles are working, what muscles aren't. Am I getting to the right alignment? Am I getting to the right position? This is how you know you're advancing into stage two. You're starting to get some feedback from your body, and it's starting to make a little bit of sense. Frustrating as hell when you can't feel it. Frustrating as hell when you just can't get it right. But at least you're communicating, at least you're talking, at least you're asking questions of your body, and your body's asking questions of your brain. Stage three, conscious competence. You're now aware of what good form actually feels like. But it takes total focus and energy to get there. You have to block everything out. Like you can't just be exercising and like someone talks to you and then you'll lose it. So you're now very aware of what your body needs, but it's taking so much demand from your consciousness that it's overwhelming sometimes. But that's okay. That at least you know what it feels like. At least you know how it's supposed to feel to make things safe. And then stage four is the unconscious competence where it's just natural. That's Tiger Woods at his peak, swinging a golf club. It's natural. It's easy. It's like the Olympic skater that's just spinning around. She's not thinking about like all these various movements. It's just the body is so tuned in. It's so automatic. It's so easy because it's the patterns are baked into the subconscious where the conscious is now worrying about other things because everything else is taken care of just through pattern, through repetition, through practice, through mastery of their movements. This is what we want people to get towards, is understanding these stages of motor learning and having a very real understanding or just some type of auditing of where you're at. Because if you're here, like a lot of stuff you guys are seeing, some of the higher level stuff, they're here. And if you're starting from here, do not think that you can do things that require this level. Again, it's like you're not going to swing a golf club like Tiger Woods like day one. It's just impossible. So don't think that that's what you need to do. But this is your path to start to get there. Way more important to do this stuff in the beginning stages, especially before you start thinking about like loading up your bone as hard as you can. You need to have this stuff first. That's why it's a principle. It's a skill. This is how skills are developed. We learned this phrase from Pavel, right? It's like you have to Pavel Satsulin, right? I've recommended his podcast to a lot of people or his some of his books because this is how he approaches it. It's a neurological, it's more neurological than it is about muscles and bones. And people completely miss this step. It's the most important step. Because these are the stakes. Move well before you move often. Having control, having form, having an understanding means that when this lady is doing a deadlift, this is something called a neutral spine. Have you guys seen this yet? Have you guys heard of this? The concept of a neutral spine? Back is straight, muscles are locked in, core is locked in, joints get into the right position. Check. Multifidus, stabilizers, stability. Make sure everything's aligned. Check. Core bracing on the front. Check. Glutes, lats, hamstrings, thighs, the strength builders. Drive the movement up. Keep it in one nice neutral position. This is what it means that you have a feel of your joint alignment, that your back is completely straight, muscles are locked in from the front and from the back. All the joints are stable. Everything's in alignment. If you do not know what that feels like to get your body into this position, the hip hinge, some of this will happen. You know how many times you see people lift and their back is all arched at the top? You see this, guys? This is what happens when you don't have good mobility or good awareness or any knowledge of what's happening at the level of your spine. Stuff like this happens. Abs aren't engaged. It's not stabilizing. Back's bending backwards. These muscles get all tight and inflamed, get all short. Your facet joints start to get inflamed. You get back pain. Like, man, my back's sore. But it's because I worked out, so maybe that's a good thing. Nope, that's inflammation. That's joint inflammation. That's muscle tightening. That's muscles getting all scarred up and all tense. These are the stakes, guys. This is what we see this is what we see. I do not say this to scare people. I say this because this is what we see clinically. Do we want this spine when we lift? Or do you want this spine? And are you guys thinking about this stuff when you lift? If you do, then good for you. You're way ahead of the curve. If we're just starting out, well, let's be aware of these things before we start to jump in. Is that fair? Deflection. This is the one. A lot of discourse about flexion. Wedge fracture, anterior body, herniated disc. These are how the flexion fractures happen. Pick up a weight with a rounded spine, heavy load. We're gonna do a bit of a detour on the principles because this is something I was not prepared to talk about today, but this one keeps coming up in the clinic and online. This discourse around flexion. And we're going to talk about flexion. Do people know what I'm talking about? We're going to like the flexion based like vertebral fracture? Do people know about are people aware of what I'm talking about? The fear around the fractures of the vertebrae when people bend forward, right? This is why people, I'm not saying this is going to happen to people. I'm saying this is the mechanism which it would happen. But with load, if you're not aware of the position of your spine, you need to learn to be aware. So we're going to talk a little bit about flexion. This is a very, very important topic. This is one that again, my experience treating really bad backs for 15 years. This is where this comes from, okay? So there's a lot of discourse right now about flexion-based fractures. You should never touch your toes. Bending forward is bad. People with osteoporosis are putting themselves at risk of, fracturing their spines. And I acknowledge all of these things can happen, but this is the condition which would happen with under load, repetitive motions for certain individuals. The compression of osteoporotic bone creates more compression on the body than the bone can handle because there's less bone. So if you flex that spine under load and you create compression on this here, that's what causes that fracture. You can also get a disc protrusion when you load flexion. You don't really know what you're doing. That disc can start to push backwards, pinch on the nerve, create sciatica down the leg. All real. These are things people need to be aware of, especially if they're going to start doing deadlifts. Not trying to scare people from doing them. Just want people to be aware of what the stakes are. But here's the thing, guys. Not all flexion is bad. Bending is a very normal movement that we're all designed to do. Every time people bend down to touch their toes, the spine bends. And if there's not too much load, if there's enough flexibility of the muscles, if the spine can get easily into flexion, for a lot of people, this motion is completely safe. It's fine for certain activities, for a certain purpose, for certain people, in certain positions. I do not believe this is something that people need to be scared about in a lot of day-to-day life, depending on, again, context. There, I'm going to have to do a longer webinar on this because this is we have too many things to cover. I just wanted to at least start the conversation because this is something that I do have quite a bit of knowledge about because I treat people with herniated disc, sciatica, degenerative disc disease, severe back pain all day. And the people with ability to round their spines easily, people that do yoga, for example, people that have generally flexible spines, their spines can flex. The spine is naturally designed, as you can see, to be able to flex. The way it's designed, it's capable of doing this movement. The problem becomes when people lose the ability to flex their spines because their back is tight and rigid, and you're forcing flexion that's not there. Tight muscles along the back, stiff back, tight hips. Person walk around just tight and aching on their backs all day long. That's the person I worry about bending forward. Not the easy, nice, fluid, flexible person. They can touch their toes. They're flexible. I don't worry about that person, guys. I worry about the people with the very stiff backs that don't bend very well. And there's a lot of people, 55 plus, 60 plus, that have stiff backs that we need to either be cautious of or see if we can do to actually increase their mobility so they can have some little bit of forward bend. So what, because guess what, guys, if you're gonna do a deadlift, you're gonna do a squat, if you're gonna do a lot of these weight-bearing loaded exercises, if you do not know or are aware of the quality of your movement, of your spine's ability to bend and flex, that's a real issue if you're going to be trying to lift 100 pounds off the ground. On one hand, you have people saying, start lifting heavy, you got to do it or your bones are going to disintegrate. And then the same people are saying, oh, if you sneeze or if you tie your shoes, you'll also fracture your spine. How, like, make that make sense. Is there not some middle ground? This topic deserves a lot more. So what I'm saying today is just the start of trying to teach some of these concepts. This makes sense. This is high level stuff. All right, I'm gonna pause for a second. Let me know, does this make sense to people? Or am I speaking like above people's heads here about the physiology and stuff? Yes, no. This was my fear. I wanted to put it in. Am I gonna die in this hill? I don't know yet, guys. But this is what I see every day. We will at some point teach people what flexion curve is, what it's not. I just didn't have enough time to fully prepare. We put a lot of work into this presentation. We still have a lot to cover, but this one keeps popping up. This one keeps popping up because we see it on people social media. They criticize some of our clients like bending forward a little bit, picking up a weight. These people have normal flexion. They have very adaptable flexion. They're fine. Other people not. You got to be careful for others. Context matters. Context matters so much. There is no one universal advice for every single person with osteoporosis. All right, let's continue. This is what they look like. Call this a uniform spinal curve. It's pliable. Can you envision a spine breaking that's like pliable? How can it? It's designed to bend that way. Pliable. It can absorb. Principle one, joints getting into the right position to absorb and react to stress. It's fine for a lot of people. Not across the board. If you bend forward, your spine looks like this. I feel much safer about this person being able to tie their shoes and sneeze without having a panic attack that they bent wrong. This person, though, stiff back, tight muscles, a lot of stiffness, a lot of tightness, can't touch their toes. They feel a lot of pressure or tension in their hamstrings. They feel strain on their back when they try to bend forward. They're hesitant to pick things up. Yeah, I'm worried about this person bending too fast, inappropriately. It doesn't mean this person needs to stay like this, because what if there's a way to get the person on the right to be able to bend a little more like the left? Loosen up this tension, free up the joints to be able to move a little better. Does that make sense? Do people know how their spines move, the quality of the movement of their spines? When's the last time anyone ever told you or had you check how well does your spine move? Do we feel that that's something that would be valuable information before we start to put a barbell or a kettlebell in front of you and start to lift it? Never. Yep, never. Of course not. Who looks? We look. There's no blanketed. Does this make sense? Some people like people that do yoga. I look, yeah, of course. That's why we don't tell people to just start deadlifting without clearance, without understanding your joint anatomy. This is what we want. That's what a lot of people have. It can improve. We'll show you a clip. We'll show you a clip. I was flexing until I was told not to. Yep. You and not the only one. Probably seen about 4 people this past couple weeks. We're just assessing how well does your spine move. We're just assessing. Touch your toes. It's like, touch my toes. We've been assessing people's toe touch for 15 years for chronic complex spine conditions because we're looking for this or this. We do not force it. And as I said earlier, all the slides before, I'm very, very well aware of the potential complications, and I do not take this lightly. These flexion fractures can happen, and we showed you the mechanism how they do. And this is my theory, my personal theory of how they happen, based off of experience treating sciatica, people that can't bend, people that can't sit, people that can't lift. And how we help them is not by having them force extension for the rest of their life, keep their backs rigid. We try to find ways to try to improve it in a very gentle, therapeutic way. And it helps, and we'll show you. They suggested one flex and you will fracture. Maybe. I don't want to say no without seeing how well the person's spine moves. Fact is, there's no discussion. There's no assessment about someone's movement quality of their spine. That's the problem. Not that flexion is bad, as no one's even looking. We got too much to cover. Principle 3. It's not just about strength, guys. It's not just about strength. There are so many other aspects to mobility and joint health and bone health than just loading you up and getting as strong as possible. There are many other domains that people need to be aware of if you're going to enter an endeavor like this. Principle 3. It's not just about strength. Sorry, guys. I don't know what's showing in the webinar and stuff. I don't know how to. So what we're measuring. 5 dimensions, not just strength. Strength is one of them. There's other components that we want to look at when we are prescribing exercise. Because we're not just building strength. We want to build a very complete movement person, a mover. Strength, control, mobility, stability, and then like agility and dexterity. We call this like a stat wheel. Each one plays a different role, and each one matters. So let's break down the wheel. Strength. Sure. The ability to generate force against resistance. Loaded movements. Deadlifts, squats, presses, carries. Why it matters? Because bone density, muscle mass, and the ability to handle daily demands requires you to have strength. Of course. And that's why we're here, aren't we? It's to help people develop strength. What do we say in principle 1? That strength is built on a foundation of mobility, motor control, stability. Right? So the next attribute for strength is the skill of moving well, motor control. Think of someone that does Tai Chi, very smooth and very fluid. They're in control of all their joints. They can control their shoulder, their hip, their back, their torso. That's what motor control looks like. Motor control is the neuromuscular coordination, the ability to control your body through space. As we just said, do we not want to make sure we have the ability to control our spines when we're picking up a weight to make sure our spine is nice and neutral? That's motor control under load. Motor control is not about being strong. It's about being skilled. Principle number 2, strength is a skill. Motor control is the level at which you're able to control your body doing any exercise. Examples, Tai Chi, balance beam work, shifting your weight from side to side, just playing around, just moving your body, movement. Sometimes people say, we'll go on that rant later. We'll go on that rant later. Mobility, talked about that earlier. The ability to move through a full range of motion with control, not just flexibility. We see a lot of people that have a lot of flexibility, but they can't control their shoulder under load. Their arms are all wobbly and stuff. We want to make sure the spine, the hips, the shoulders, and the ankles all have unrestricted movement to be able to get into the right positions to absorb and react to stress in a positive way. Because if it does not, your joints will get inflamed, your tendons will get inflamed, your muscles will strain, and something will hurt before you ever get the chance to build load into your bones. We have to look at mobility anytime we're engaging any exercise that we do. Stability, the ability to control and support your body in one position. That's a nice stable plank. Make sure again, stability. Imagine that graph, that picture we did of the spine in neutral, stable, stacked, everything in one alignment. You have small muscles that stabilize each joint to keep them in place. Your shoulder, you're doing a press. You have your rotator cuff muscles, your shoulder girdle keeps this thing stable. So your arm isn't all floppy and wobbly if you're holding something under load. If you're doing a squat, you need your hip stabilizers to be stable. Or else your knees are going to start caving into one another. You're going to start developing like kneecap pain, knee tendon pain, things of that nature. Why stability matters? You want to load an unstable foundation, you want to load a stable foundation. We need to make sure our exercises address all of these domains, not just strength. Agility and dexterity. Balance, footwork, reaction time. Your nervous system's ability to catch yourself before you fall. Your reflexes. Tai Chi, Zumba, dancing, agility drills. You have probably seen Pam, our client, doing these little step drills. We're not just doing it for impact, we're doing it to train her footwork so that she has faster reaction time. We do that because she's really strong, but we've loaded up a lot of strength, and now it's time to start balancing her program, start working on agility. She doesn't need any more strength. She's as strong as she's going to be. We might get her a little stronger, but it's more important for us to start working on some of this stuff because this stuff matters as much. The strong T-score, like, I don't want to say it doesn't mean anything because if you fall, because if you have a stronger T-score, it's going to matter because you may not fracture. But if you have a bad T-score, if you're not at a position where you can actually build the strength in your bones to, because you're just at that age where it's not going to be hard. It's not going to be like you're not able to lift the amount of load that's required to actually stimulate bone. Maybe work on this stuff. Maybe just work on fall prevention. Get your feet like really agile and dexterous. Because a fracture prevented is just as important as a fall that happens and your bone absorbs the shock. Maybe you just prevent them just through insane balance and footwork, and then you're fine. So you want to be complete. You want to have motor control, balance, stability, dexterity, and strength. This makes sense to everyone. We can load them up. We can load weights. We can get really strong. We start jumping. But if you're ignoring these other domains, you're going to be very unbalanced. And then you're going to start loading on top of unstable, stiff joints and without good control. Do them all. They'll all feed into each other, and you'll get better across the board, and they'll compound into each other, and they won't take away from each other. So let's talk about some scenarios, because people can get imbalanced and lean too hard in one direction, which can potentially cause issues if you're not aware. So we're going to talk about these various issues. The yoga teacher scores high in mobility, good balance and stability, maybe some stability, it depends. Someone that has a lot of mobility bending forward may not have as much stability to keep those joints locked in, and maybe their muscles aren't as strong enough to protect those more looser mobile joints. So if you are someone who's very like hypermobile, who has a lot of flexibility, but may not be very strong, it doesn't mean you can't lift weights. It just means you need to be acutely aware that you may be lacking stability. And you need to work on learning how to do that to make sure you keep your body stable because you have excess mobility that you have to be stabilized against. The CrossFit athlete. This is someone that loads up on strength, but is very immobile. They're all strong and muscular, but they're very stiff. They can't touch their toes. There's no pliability. This is what happens when you load too much on strength. You get immobile. You get that stiff back syndrome, tight shoulders, can't touch their toes, they feel in their hamstrings because their back's all stiff. This person, we don't need to do any strength work with them. They're plenty strong. We give them more mobility, we give them more agility, more stability, and then their strength will enhance because it's no longer being limited by their lack of mobility, their lack of stability, their lack of dexterity and agility. The Pilates person, very stable, great posture, no strength. And that's fine. Pilates is a great foundation. We see a lot of people right now. I see a lot of people in this space. We're new to the space. We're just getting oriented, saying things like yoga's bad for you. You shouldn't do Pilates, Tai Chi. It's not bone stimulating enough. What are you guys talking about? How is having a stable, good posture not a good for you, not a good foundation? Yeah, it's not going to get you strong, but it's going to get you stable, which is a great foundation to build on. And people are saying you got to start lifting heavy. Yeah, I get that, but if not on top of unstable, bad posture, bad motor control, poor mobility, right? This is where all these things fit. Yeah, is yoga and Pilates going to be the most bone stimulating thing for your osteoporosis and your T-score? No. But is it going to give you a really, really solid foundation? Make sure that as you lift, you're going to be in a much better position than those that are just starting out and just jumping into lifting weights? We have some people right now. They did Pilates for like 10, 15 years and are like they feel bad that, oh my gosh, I didn't know Pilates was enough. No, it's plenty. It gave you a really good foundation because guess what? These people are lifting like 40 pounds day one because they know how to keep their spine stable. They have good posture, they have good understanding, they have good motor control. They've been focused on these things for many, many years. They've developed a lot of that neurophysiological just control and understanding of their body. Sure, maybe it's time to start lifting weights, try to improve the bone health, but to say these things are not effective and that they're a waste of time, it's like the craziest thing. Do both. Do Tai Chi and weightlifting. Why not? Why don't you do both? You'll get better at each other if you do both. We don't want this. Person just starting out, no understanding of any foundation, being told online, start doing barbell backlifts, barbell squats. Are you crazy? No foundation, no assessment, no understanding of how well the joints move, how well the ankles move, how do the knees accept load, how mobile is the spine, how stable is the spine? Can you feel your core? Can you feel your glutes? This is what I worry about. I worry about this person right here. This is literally who I we stay awake at night worrying about this person. This is why. It doesn't mean you can't do this. It just means we need to have some understanding where you're at so we can build up to a point you can start doing these things. Is that clear? Does everything make sense? We've gotten it wrong. The reason I say these things with such a level of confidence because this comes from mistakes that we've made as a clinician over the years. The worst feeling in the world is when we work with someone and we dial it up too much in one domain and they feel they're they're flared up. They're in a little bit of pain. It happens, guys. Even under our watch. It's the worst feeling in the world. Someone comes to us and they trust us. We're so careful. We're trying to push them, we're trying to encourage them, we're trying to get them up. And when we try to load up in one category too much without shoring up all the other things, mistakes happen. People get hurt. Luckily, the levels of injury that we typically see are going to be very minor strains, recover within a week or two, but still, it still feels awful. That's under clinical supervision. Now I worry about the people that are doing this without any supervision on their own at the gym. Skilled movements under load without any assessment of what your body can and cannot do. That's what I worry about. That's why I'm doing this webinar. Strength is only as good as the system supporting it. If you don't have a balanced system, it's going to lead to problems. All right. Some people are really good at some and not as good at others. You don't need to be fully balanced across the board. You just need to be acknowledging that all these various domains exist. Some people are really strong and lack mobility. That doesn't mean they need to, start doing heavy yoga, but maybe that person doesn't need to load up as much on strength. Maybe they need to focus more stability, more mobility, just to make sure that they don't like load up on strength too much. Quick break, guys. Quick break. Is anyone still with us? Are we boring people yet? We got a lot more to cover, guys. I told you this is going to be a long one, but this is all important. This will be available. You guys can watch again. Does everything make sense? Does anything need clarification? Just need a quick little break because we're going to be going to some pretty deep stuff next. Is anything unclear? Is it too advanced? I'm gonna get a read. Let me know, guys. Type in the chat. Taking like a quick little break before we get into the next stuff. We're gonna get into exercise. I know you guys are here for exercises, but this stuff is way more important than just showing you what exercises to do. This is what I'm thinking. This is what I think about. This is what we think about in the clinic. We want to get people to a point where they can do something about their bone health. We're not trying to scare people or fearmonger that, but you better damn know what can go wrong. And this is how it goes wrong. We see injuries, we see pain, we see like all these things. So we have a deep understanding of the things that can go wrong. We have to. So we have to make sure that those things are at front of mind before you do things, is to make sure that you're thinking about what can go wrong. So you can make a plan to make sure things go right. Better late than this stuff is not readily available. We'll talk about like virtual offers and online stuff. We'll talk about that. We're not ready for that yet. Regular massage, man, regular massage is going to help you like stay loose and make sure you're recovering and stuff. So all very important stuff. So much great. I didn't even know about, I just need to find someone who knows a lot about bone health. You don't necessarily need someone that knows stuff about bone health. They're harder to find. You need someone that knows things about mobility and joint loading and safe loading mechanics and body awareness. You'll find that in a Pilates instructor, a good physical therapist, a good hands-on therapist. There's not a lot of like bone specific health people. And the ones that are quite honestly telling people to start stomping their feet and start slamming their heels, start jumping, start doing these high-end stuff. It's like, whoa. Not you need like yes, but you need to have an understanding of what it takes to get to that point. You don't need bone specific. You need joint health, mobility, strength, all the things we just talked about. That's what you need to build bone, not just bone exercises. That's the easy part. All the stuff we're talking about is the hard part. You're very welcome. We'll be sharing the rest of it. This will be available on YouTube. We're going to try to post it up into clips. Plantar fasciitis. Yes, like plantar fasciitis is so difficult to treat. It's one of the most difficult ones to treat. It's so hard. It's very hard. When I see, I'll go on the heel slam rant. You guys want me to do the heel slam rant? The foot stomps? For the advanced person that's been building up gradually over a very slow, gradual period of time, they're fine. A beginner, just starting with like heel drops, 3 sets of 10, day one, that exercise should be called how to develop plantar fasciitis, how to get a bone spur in your heel. All right. Best structure for monitoring. Mobility is what I'm looking for. Yeah, like we, I'm just one person, guys. I just share what I know. Um, we really hope that if things like this continue to go well, we'll get the. I do not consider myself an expert, guys. We are a business owner just sharing what we know. I learned my stuff from the real experts in terms of like like Belinda Beck, the people behind Lift More. Those are experts, not me, right? They're the researchers. Uh, the people I learned functional movement systems from Gray Cook. That's the expert about mobility. I learned stuff from him. Pavel, right? Strength is a skill. Listen to Pavel's podcast, Pavel Satsulin. Listen to his podcast, hear him speak. I just faithfully implemented what these people told me to do. We'll get Mark Cheng. We'll talk to him, the guy I took the functional movement systems course from. I remember stuff for like 15 years of things he taught me in like a couple hour course. We'll get you guys the real experts. Stu McGill, loading of the spine, the biomechanists, they actually load spines. That's the expert. You're not looking for an osteoporosis expert. You want people to be expert about loading the spine. Stuart McGill. You guys want some podcasts to watch, some YouTube. Stu McGill. You guys want to start to learn about loading of the spine, how to do it right. Literally wrote the book. That's the expert, not me. We know how to make cool slides and presentations and stuff and some cool videos. I learned from the experts. Books you can recommend. We'll stay on the newsletter. We'll share everything we know. Stu, STU McGill, Stu McGill. You guys want to start learning about biomechanics of a deadlift? Don't talk to me, talk to Dr. McGill. Right? That's what I learned my stuff from. I hope he doesn't watch our stuff and say, "Oh, you were very wrong." Right? Again, that I defer to these people. Are we ready to continue? Any other pressing questions? Any other comments? Anything else? Or shall we continue? Are we good to continue? Let's go. Train to feel good. Some we have clients on this webinar, I think, that are here. And every like we'll teach them an exercise, one that they didn't know they could do. And I know we're on the right track when they say that felt good. That felt good. It didn't hurt. It didn't feel sore. It felt good. Right. So we're going to try to unpack what does that mean to train to feel good? Because this is, again, something that people need to keep these principles front of your mind if you're going to be doing this stuff, either on your own with a trainer, with anyone, physical therapist. If they don't know this stuff, then at least you know it. You'll know more than them, right? Train to feel good. Because the belief that's been held for decades is that you must hurt to get gain. No pain, no gain. And there is a kernel of truth here because pushing yourself does drive adaptation. That's why this belief has stuck around for so long. but we've learned a lot more about how training works. The old belief is that in order to get gain, you must destroy your body, and then your body must regenerate itself, and it turns into a stronger body. And that is true. That is not untrue. And there are a lot of people who are not training at all and then adopt a no pain, no gain, and they train very heavy and they get really good results. They feel a little sore, a little achy, a little stiff, maybe some tendon stuff, but they feel so much better than not training at all that they just accepted that this is just the way that it is. But the problem is when you're all sore and beaten up, those aren't real signs of progress, and that is not the thing that we want you to be rewarding with your program, with your workouts, or with your exercise, because that's going to lead to problems. How do I know this? And anything I say, guys, comes from just things that I've seen that I think would be worthwhile for me to share with you guys. Before my wife and I started our clinic, I worked at another clinic that literally was next door to one of these high intensity boot camp classes. You guys ever hear of these? HIIT training, 5:30 a.m., burpees and jump squats and kettlebell lifts. And these classes were filled to the brim of people 45 to 65 just trying their best to get healthy. And they heard about this fitness craze, things like CrossFit, boot camp classes, a way to get get back in shape because, yeah, kids, lives, family, jobs, it all takes away the ability for us to sometimes put our health first. So people try to make up for lost time. So they'll do these high intensity classes and they'll get some results pretty fast. But working next to one of these these gyms, literally dozens of people every week would literally be crawling in to the clinic because they threw their back out, they tore up their shoulder, they damaged their meniscus, they uh they sprained an ankle, they have shoulder bursitis, they got sciatica from like doing things. And these were people that thought that they needed to punish their bodies and to feel trashed in order for them to feel like they got something good out of it. And the mistake was they were getting a lot of benefit because they were losing weight, they were feeling better, they were looking better, but they felt like crap internally, all inflamed, tight, stiff, literally crawling in. When we see things now what people are doing without understanding of everything that we said before, mobility, control, stability, and things like that, and I get flashbacks of this happening again. And we don't want people to do stuff like that, right? So there is another methodology that works better, more effectively, more efficiently, and most importantly, will keep you in the game for long term, because that's essentially what you need to do if you're going to be talking about trying to improve your bone health. Bone health is a long-term game, years. It takes years to see significant bone growth. So if you're trashed and can't train, if you're injured right out of the gate, not only do you have to recover from that injury, but you'll also lose ground due to atrophy. So we say these things not because we're trying to scare or fearmonger, it's because we're trying to actually help you guys improve your bone scores. And the number one obstacle to that happening is an injury or pain. So there's a different methodology to train than no pain, no gain. You can train to feel good. So your body's going to adapt much faster when you're challenged and also recovered. We want you exercising and building strength consistently, not just one-offs and having to recover for a full week because you can't walk because you crushed a workout. No way. So here's how we start to think about what it means to train to feel good. Anyone download our guide? You guys read our guide? levels. There's levels of exercise, there's levels of intensity. People need to be aware that intensity of exercise lives on a spectrum from very easy to very difficult to everything in between. There's a spectrum of difficulty. My wife Twee's in the back. She might get a little upset at me when I talk about this. Hope she doesn't. I've played video games over the years. I'm not going to get too deep on this because you'll get mad at me. And there are these games. Uh, if you imagine like Lord of the Rings, with like wizards and dragons and little halflings, and that imagine if you're like one of these like little like halflings, like Frodo Baggins or something like that. You're starting off on your journey, and you start at this place called level one, and you're a newbie. And you have like a little rusty sword, you have a little wooden shield, and you have to go and kill these like little rats to gain experience. And then when you walk around these areas in these video games, you see someone with that's like glowing. They've got like all this like fancy like armor. They've got this big giant sword. They're very big and intimidating. They're like riding this giant horse. It's like, wow. But I'm this like little like newbie with a little sword. That person is a higher level. They're like level 50. And we're just like level one starting out. So what happens is when you go out into these little areas, start killing these little monsters, these monsters above their name are colored blue, green, yellow, orange, and red. If you encounter a red monster, that's like too high above your level. And if you try to fight that monster, it'll take you out. But then if you find like a blue monster, it's too weak. It's too easy for you. No challenge. You don't get any, like, you don't level up from that. So when we talk about train to feel good, we're talking about where in the spectrum of intensity are you training? No pain, no gain, high intense interval. Here, you're taking on things your body may or may not be ready for, likely not ready for. Higher the risk, higher the reward, or higher the reward, higher the risk, higher the intensity. Too low risk, just as bad because you lose to atrophy. We want to find the middle zone that's appropriate for each person. Does this make sense, guys? Is this clear? The guide is on all of our websites. People type in bones and guide and stuff. Does this spectrum make sense? Am I talking like is this like resonating? I want to make sure because this is like the crux of like the rest of the presentation. Do these colors like does it make sense to you guys? I want to make sure because like literally the whole rest of the program is we talk about intensity zones. Can we understand that we see sometimes people on social media doing level four heavy intense stuff, and people might be here, and we feel a little bad and intimidated that I got to be doing this stuff. Like it's amazing. It's pretty cool. I'm impressed. It's like it gives us a path forward. Like that's what we can do. It's freaking amazing. I like seeing it. But we also understand most people are going to be starting, they're going to be starting from the beginner zone. And it's like you can't be doing the intense stuff. But this is your path. And that's fine if you're green. Green is good. Just stay there until things get easy. And then you can start to entertain the idea of going up. Don't go up too fast, but don't stay where you're at because you'll lose to atrophy. Blue and purple zone, atrophy. You don't stress your body enough. This is like walking. It's fine. It's nothing bad with walking. It's just if you're worried about bone health and osteoporosis, you're losing ground if all you do is just this. It's safe. There's no risk, but that's the problem. I like green and yellow zone. I don't mind staying here longer for some people. We try to push people along the spectrum as fast as possible, but we always prioritize risk of injury and pain. The coolest part about what we do is when we actually get to make progress. And we actually see someone leveling up in real time. It's the coolest thing of what we do. It's because we just stay at this green zone for like months. Who here has seen like I'm gonna ask again, the lady, like have you guys seen the lady, the Carol with the cane? And she does the little, she just puts her foot on the step for like 4 months. We kept her at this zone for like 4 months, green and yellow, and she just kept making progress. It wasn't too easy where she wasn't being challenged by it, but it was not too hard to the point where she was putting herself at risk and getting hurt. We had to find exercise that she felt comfortable and confident doing that still challenged her, but still, you know, we're still safe enough for her to like be able to do. Green and yellow. You don't want to be like too far green to blue. We want to try to find some of these zones, especially while starting out. High risk, high demand, high reward, kettlebell swings, weighted jumps, weighted vest jumps, heavy deadlifts. The problem, no, I don't want to say it's a problem. It's just how I think. Because I'm not in a position because I don't know these research. I don't know these people. I have nothing but admiration and reverence for people that run studies like Lift More. It's why we're here today. We wouldn't be having these conversations if people don't do studies like that. When I see the exercise that they did, I for the population that I treat, 55 and older, pain and injury, the exercises that are in that study are like for most people that are here, and most of our clients are like blue green. We want to get them to do these things, but they have to earn the next step to get to that point. And sometimes they don't get there, and that's fine. But we don't want people feeling bad that they can't do the hard stuff yet if they're at a lower starting point. We just want to give you guys a path to understand what it takes to get to this point. You just want to get you as far as possible. That makes sense. Because here's the thing. When you do higher level intensity of exercises, you get a bigger stimulus, but you have bigger adaptation, but you have bigger recovery demands. It's going to take longer for you to recover. There might be some more muscle straining, some more tendon injuries, some more inflammation you may have to deal with. And guess what? That's fine. As long as you let your body recover and then make sure your body is in a position where it can then train again. The difficult thing is when people jump to zones they're not ready for, their body feels like it feels they're in a lot of pain. They're stiff. They can't get out of bed. It's like that's going to dissuade you from doing it again because it was too much and you just didn't realize it. This zone has to be earned. I don't use sparingly. It depends. It depends on what you can and cannot do. But just you need to be intentional about it. You can't just do. You have to be intentional about it. In the beginning stage, I think most people should be living in that green and yellow, trained to feel good. You're challenged, but you're not thrashing yourself, especially in the beginning stages. Orange and red, used deliberately, not by accident. You have to use it with intent. Blue and purple, those are your legal recovery days. Not your building stuff, but there's still a use for those types of things. Go for a nice walk, recover, work on some movements, warm-ups, and things of that nature. It's just you have to just understand or just be thinking about when you're doing an exercise, are you at that level? Is your body ready for the exercise that you're doing? Are you being challenged or is it easy? Right? These are things that people need to be actively thinking about when they're doing an exercise. How do you feel afterwards? How did you recover? Did you wake up the next day and feel nothing? Good. Stay there for like 2 weeks and then move yourself up just to make sure nothing bad happens, especially if you're just starting out. Comfort also has a cost. You don't want to stay too easy for too long, as we said. You're going to lose ground. Remember the study? People that were doing low intensity home workouts were losing bone in like 8 months, like 2%, 1.2%. Playing this game, guys, right? We want to find those thresholds in which people can train safely and confidently, know they're making progress and know they're not hurting themselves. This is the hardest part about what we do because it's not you can't read a book and say, oh, this is my level. It's something that it's earned, it's felt. It's you know your level because maybe you made some mistakes and you went too hard. You're like, oh crap, that was too hard. I couldn't move for a couple of days after that. Maybe I got to back off. Or it's like, I've been lifting this pink dumbbell, this 2 pound weight for like 8 months. It's like you're punishing yourself that way too by keeping it too easy, too light for too long. Understanding these zones and these levels, this is honestly where the clinician, the skilled clinician knows exactly where you're at because it's not just you. They have thousands of people that they've taken through these progressions and have it just an intuition based on how you move and how you feel when it's time to progress and when it's time to pull back, when to push and when to show restraint. So people that are looking for trainers and therapists, that is the person you're looking for is people that has some understanding of meeting you where you're at and helping you move forward. Don't just look for someone that's bone certified. Just look for someone that's just really understands movement quality, has a lot of experience working with an older demographic, can start you safe, can start you light, aren't going to just push you and thrash you and just count reps and just burn you to the ground. That's not a good trainer. They're making you live in the orange and red zone because they're still stuck in the old mindsets of no pain, no gain. Calibrate it down a little bit, train to feel good, let those gains compound. You'll see some changes within 3 months. All right. Train to feel good, but you also, as you said, you have to be challenged to change. You have to be challenged to change. Comfort is the enemy. We spoke about that way too many. We've spoken about that a lot already. So you've done the work. Maybe you've started a program. You've gained 10 to 12 weeks of momentum. Your body feels good. You're like, hey, I'm doing like these assisted squats. I do some sit stands. I haven't exercised in like 10 years, and man, I can feel a little bounce in my step. I feel genuinely good, and I feel like I'm ready for that next level. So now what? Now it's time to level up. Back to this game that we're talking about. One of the most fun things about why you play these games is because you don't stay this like newbie with like this little rusty sword and this little wooden shield forever. Because who's going to play that game? No one wants to do that. The fun thing is when you actually stay at a level, you kill like 10 rats, and all of a sudden you turn level two. It's like, whoa, there's this big sound that comes, and then you're level two, like you get a little stronger. You have more like health points, right? Your hits do more damage. You learn how to cast a spell. Like cool things happen when you level up, and that's why these games are addicting, is because it's allowing you to feel the sense that you're making progress. Strength training is no different. It's the same thing. It's just applied to your own self and your own body. You are that little character trying to acquire abilities and try to level up. And if you don't know that you're playing this game and you're just overshooting things for things that are just unattainable, you're fighting a losing battle at that point. If you're just staying safe at this little zone and you're not actually making progress, then you're wasting your time. So when you level up, you go to like a different zone. All right. And this is what happens. When you level up, the spectrum, it shifts. First spectrum, kettlebell deadlift was yellow. The swing was orange. The vest jump was red. T-Rex squat was green. Walking was blue. You level up. Now the swing is yellow. The deadlift is green. The assisted squat is blue. Now the vest jump, the jump squat becomes within reason. Yes, there are still risks, but now you've leveled up. Now you can start to entertain the idea of doing this, but only after you've mastered something like this. You don't jump from blue to power. You don't jump from T-Rex squat to power clean. You level up. The things that were challenging then become easy. Now that means you're ready to try to take the next step. You don't level up right away. You stay at this level until you've done enough reps. You've allowed those adaptations to really take hold. 6 weeks is a good rule, right? This is the hardest part about what we do, is to have our clients take that next step into the next level when we don't have any sense of readiness. Like Pam, 72, she swings the kettlebells, the redhead lady. She was doing deadlifts for like a year before she did her first swing. And the first swing she did was like a pink dumbbell just to learn the form. So there's ways to level up where you take little baby steps and you ease back. Take a very cautious approach as we start to increase levels. Right? Does it make sense? As you improve, everything, the spectrum shifts. Talk about this. Higher demands, more recovery time. So one of these things happens when you go against like an enemy that's like a little bit more superior to you. You're like in this battle. You have to fight harder, you lose more life, you're drained afterwards, but you win. And then it takes a longer time to recover. And that's okay. As long as you didn't go past your zone. But just understand that if you're going to be starting to go for higher level things, more difficult, more strenuous exercises, that you need to understand that's going to need to require more recovery time before you do the next one. So there's always that trade-off. Hence why we like that green and yellow, because we don't really like for people to have these long recovery times. We'd rather keep people at a level, yellow and green, for a long period of time, just make sure they own those movements and just take little baby steps towards the next step and make sure they own that as well. It's a much safer way. It allows people to just be in the game for longer, and that's what we want to be able to do. The test the water strategy, just dipping your toe in the water, pull back. Dip your toe, pull back. Till it's earned, till one rep done. Like when we go up in weights with our clients, right? We're going from like 10 pounds to like 15 pounds. It's like this huge thing. Oh my gosh, we're going up 5 pounds, guys, on overhead press. And it's hard. It's very demanding, especially if they've never like lifted 15 pounds in their life. Going from 5 to 10 is a huge jump, and going from 10 to 15 is like a huge jump for people. But they're doing like 10 reps at 10 pounds with like ease. But we've never done 15 before. So we don't just start doing like 10 reps of 15. We just do one rep at 15 and just call it a day. Did anything bad happen? Did you hurt? Did the form hold? Maybe a little compensation to get up there the first time. Because if you don't hurt the person, they'll show up the next day and then they can do 2 reps the next time. Too many reps, too many weight, too much weight, too fast will cause a flare up. They'll have to call and say, my shoulder kind of bugging me. We just lost like 10 days of progress because we just went like 3 reps too heavy. That's what happens. So just one rep and just check to see did anything bad happen. Okay, nothing bad happened. Okay. Let's just say like one rep at the new weight for like 2 weeks. And maybe by week 3, if nothing bad happens, still feels good, No injury, no inflammation, no recovery. Okay, now we'll try 2. Then we earn 2 reps for 2 weeks. 3 reps. So over a 8-week period is how we transition from 10 to 15. Not all at once. Sometimes we push people too far. It happens when we push people. It's the only way we know when we've gone too far, because we don't know until we've hit someone's thresholds. So let's say we push that person, they went from deadlift to kettlebell swing. It was too many reps. We did a little bit too hard. They feel stiff and sore, a little pain the next day. But it's not so bad where they can't train. They can still walk around. They're just more sore than usual. And that's fine. That happens. That doesn't mean you stop. It means we regress. You can level up. You can also take your program and you can regress it down a level. A lot of people starting off, they're like, man, are you sure I should be picking up a 25-pound deadlift? No. Why don't we start with a pelvic tilt? How about a glute bridge? How about putting your foot on a step? TRX squat. Wow, that's really challenging for a lot of people. Might be very easy and like blue and it's like a waste of time for some higher level. But this TRX squat might be the thing that it's like slightly beyond your current threshold. Maybe you're just at like a little step. And what we're telling people, it's okay to be at these levels, but just know that there's a next level. You can level up. You can also regress it down. If the game that you're playing, the difficulty zones are just too high, like, man, I did T-Rex squats. I lifted this 20-pound weight. I can't move for like a week. It's like, oh my gosh, that was too much. We regress it down. Let's work on some balance. Let's work on some stability. Let's work on mobility. Let's work on some breathing. Let's work on motor control. Let's not try to bone max and start doing heavy exercises until we've established the level at which it's safe for you to make progress and make sure you're not training too intense and make sure you're not training too easy. It moves in both directions. Where the magic happens is right at that threshold, the Goldilocks zone, the sweet spot. Not too much, not too little. Not too big, not too small. Not too hard, not too easy. All right. That is the thing I personally am always thinking about. Every step, every rep, every patient that comes in. We are paying attention to every single one of these things. Is this at the zone? Is it too easy or too hard? Too easy. Oh, let's move him. Wait, let's challenge it. We don't have time to waste. We're losing against atrophy. It's too hard. Let's dial it back. Oh, you felt a little tweak there. Okay, let's dial it back. Let's regress it. Not ready yet. So when you guys look for people that are watching you intently, every single rep, every single set, every single movement that you do. You don't need an expert. You just need someone that's going to give a crap and actually look and make sure they're paying attention to you. That's what you need in someone. That is far more valuable than someone that they obviously understand a baseline of movement. They understand some level of anatomy and biomechanics. They're not a complete, you know, just a weekend trainer, right? I'm not saying that just find anyone. But you're far more better off someone that's going to pay close attention to every single thing that you do, is going to modify things very, very fast based on how you respond. Make sure they communicate with you. Make sure they're always asking questions. How do you feel? How did that feel? Was that too much? That's the type of person you need to look for. Like bone certifications aren't like, I don't know a lot of people that like bone certifications, guys. If you're looking for someone, look for someone that gives a crap. It's going to pay attention to you with some medical training, physical therapist, a very elite personal trainer, even a chiropractor that has a lot of knowledge of weightlifting and things like this. Okay. They will help you find that sweet spot. That sweet spot is for some like from like me and some of the clinicians that I know that I've worked with in the past. We've earned it through experience of just of unfortunately making mistakes and people and pushing people too far, or keeping people too low at a level where we were just wasting their time. Right? It feels bad either way. That sweet spot is something that's very that's where clinical mastery is really shown for people that understand people's at their level where they're at. Quick break, one more principle, and then we're going to go into the exercises. Quick break. I gotta take a quick break. Can we get some feedback? Is anyone still with us? Or have we bored everybody yet? I haven't even checked to see how many people are still on. Who's still with us? Is it too theoretical? We're going to get to exercises soon, guys, but this stuff is more important than any exercise I will show you. Do the colors make sense? Do the zones of difficulty make sense? Are you guys thinking about what you're doing instead of just doing? No, 2 hours is not perfect. We're going to go 4 hours, my friend. 2 hours is not nearly enough time. We'll go 6 hours next time. And we still won't be done. People that do not have the attention span to take this game you guys are playing seriously, you're gonna get yourself hurt. Don't put it on me. Want the quick 20-minute workout? Go do that. Want to spend 6 hours learning principles and applying them slowly, carefully, finding people that understand this stuff, you'll be way better off. Two hours, too long. Sorry, I'm on a roll. Sorry, guys. I don't mean to speak negatively upon people. I'm just poking fun. I'm just saying it's not long enough. Not even close. We got to be doing more of these things. We have interviews coming. We'll be talking to actual experts. Actual experts. The people I learned this stuff from. We're gonna get you guys on. Yeah, nutrition. Like I'm not even a nutritionist, guys. That's a game of bones, guys. That's another spectrum. Hormones, nutrition, recovery, devices. Like we're just talking about the loading stuff. We're not. This is just like 20% of what you guys need to do. This is a very and this is this thorough just for the loading and strength training. Passionate, yeah, and of course, been doing it for this is told you this is the bone stuff. This is where our career starts coming full circle. No time for individual attention for PTs. Oh, they're out there. They're out there. I'm telling you, they're out there. I see them on Instagram all day long too. I don't particularly like being on Instagram. It's just we have to for business sake, and I feel like it's helping people. But keep looking. They're out there. A lot of lazy physical therapists out there. Lazy physical therapists. They just want to pack it in, do the same exercise for the patients. They don't care about making progress. They're just there for their paycheck and they want to go home. An unfortunate truth. There's some really passionate ones out there. Start following them on social media. You'll find some. Just make sure that they speak sense and not just making you do crazy stuff or crazy exercises. Right? The stakes are too real. I know Dave Candy. I know him. He's a very, very good guy. I like Dave. Follow his YouTube channel, guys. Dave Candy. He's a very nice guy. Okay. Let's continue, guys. We have one more principle and then we have exercises. Are we ready to continue? Oh, crap. Compound effect, principle 6. This is where your gains solidify. We all know this. Compound interest. People put money in their retirement account, skyrockets up. Compound effect. This is how you solidify gains. This is where you start month 3, week 2, month 1. There's just no progress being made. And you're not changing any bone physiology in the first month. You can get hurt in the first month. You can feel stronger in the first month, but you are not by any shape or form changing your bone physiology in a month. This is an 18-month process for most people. For a lot of people, even more than that. Liftmore had people show changes in 8 months, but they were selecting people that could do the exercise to actually stimulate bone. The vast majority of people are starting from a way lower level, and the loads that are required to actually change bone are much higher than what most people are starting at. This is the main point that we want to get across. That's why we're going like 4 or 5 hours on this stuff. This is how you get to the next level, by just not dying and not losing and not getting hurt and just staying in the game for a long enough period of time and let those gains start to solidify and compound. Because it goes in the opposite direction too. This is, you guys can judge me whether or not I'm a bone expert or not. For me, I feel like I still need to earn my way to that point. We want to get more case studies, we want to get more people in. We want to get some real data, some real feedback. What I will claim to be an expert on is understanding this curve. So I treat pain and injury, chronic pain, majority of what we do. Person starts with an ache, a little stiff, a little tight. It's like, man, it hurts to move. You know what feels really good is when I sit and just take pressure off my spine. Ah, my pain is gone. And nothing bad happens for a couple weeks until you try to get back up. And now, man, getting out of the chair starts to hurt. You feel a little hip, the back strains. It takes like a minute to stand up straight. Like, oh man. Then the knee starts bothering you getting up. Then you stop doing things again. And then it's hard to stand up straight. You have to lean onto stuff. You get what I'm saying? It goes in the opposite direction when you don't do enough. You may not notice at the time, but things decline slowly and then they decline fast. Same thing happens on the way up. One workout isn't going to do it. People start training, expecting results in weeks, and nothing happens, so they get discouraged and they quit. Or they push too hard too fast, they get hurt and never come back. 1 month of training does not transform you, but most people quit before month 2. New Year's resolutions, guys. Ever seen the gym around New Year's? Of course, this is what happens. If you want to rebuild your skeleton, because that's the game we're playing, right? We're trying to rebuild our skeletal system, right? 90 to 180 days for just meaningful like remodeling. Every workout's going to send a signal. We need stronger bone here. And that signal has to repeat over time to actually rebuild over a long period of time. If you miss 2 weeks, if you miss a month, if you skip a workout because of pain, injury, or just life got busy, or just things happened, like, you have to take care of a parent, you have to, help watch the grandkids, you just don't, you know what I mean? You're going on vacation. Not to say like if you miss 2 weeks, I don't want you to feel bad. This is not what I'm trying to say. But it's the consistency of staying in the game over time. That's the only way this happens. The people you see on our social media, that they're the ones that are swinging the kettlebells, doing the jumping, they've been with us for years. Years. The first 2 years, Pam, the redhead lady, the first 2 years she trained with us, her scores went down. We weren't training for her bones, but her scores went down. Because guess what we were doing? We were doing bird dogs, we were doing planks, we were teaching her how to lift her arm, we were trying to get her range of motion good, we were trying to teach her how to get stable, we were trying to teach her alignment. We were just lifting very light loads for about a year and a half, 2 years. But she stuck with it twice a week, every week, 3.5 years. And then last year, she just poof, takes this huge leap, swinging kettlebells, lifting 70 pounds, full deep squat. Impossible to have done the first year and a half. There's no way. She just physically was not capable enough. Couple years. Now she's at a point where she's hit this compounding curve where she can do a lot of really cool things. It was earned. Years, not months, not weeks, years. Consistent. but not static. You cannot expect growth lifting the same 2-pound dumbbell for 3 years. That's not how it works either. Consistency at the right challenge, at the right zone, because remember that zone changes, guys. That spectrum shifts. If you level up, you have to level up your exercise, or else you're going to be at blue and purple. You're going to atrophy. Despite the fact that you've earned this level, if you stay at that level and never progress, you will start to lose ground. But then if you go too heavy, you have to know when to regress back. The compound effects only compounds if you keep entering that same challenge at that level, like between green yellow to yellow orange, within that zone. Say clear of the reds only when you feel ready to, and make sure you don't stay in the blues too long either. So it's a conceptual framework that you always have to be gauging. Too hard, too easy, too hard, too easy. Pain, injury, or excessive recovery times will knock you out of that consistency entirely. The challenge and the consistency has to be sustainable. You can't just be at intense all the time either. It's not going to work. You'll get fried. You get tendon injuries. Your body will ache. You'll feel sore. We see people. We get messages from people that, and they send me our workouts. Like, man, that workout would crush me, man. That's like, and you're doing it like 4 times a week. They're cooked. They are in recovery debt. They're not letting their bodies recover enough. So they're training hard, but they're breaking down at the same time. Not as common, but it's definitely happening, right? Then this is why, because they're swimming in the red and orange and don't realize that they are, because they're being told they have to be up there, but they're not. Maybe they're at that zone. They're not allowing their bodies to recover enough, and so that the consistency is not there. They cannot no longer make progress because their tendons are hurting, their back is hurting, and those pain and injuries start to accumulate because they're not allowing them to recover long enough. So how do you know if you're making progress, right? That's the hardest thing is like, oh, I've put in 6 weeks work. How do I know if I actually did anything? Problem with the bone game, the game of bones that we're all playing is like you don't get to know your score until 2 years for a DEXA scan. That's too long. Like it's too long. We have like blood tests, CTX, P1NP. Going to try to bring some of that stuff here just so we have some data of whether or not we're actually moving the needle or not. But there are other ways to be able to track and measure your progress that's going to be not definitely relied upon like 2 years of data point. It's just too long. So we have to have other ways in which we can try to see if we're actually making progress or not. So how do you know if you're making progress? Your body starts to talk to you in a good way. Not like I'm sore and achy, but it's like, hey, I kind of feel different. You start noticing when you slouch because you've been doing this like deadlift that's like strengthening the stabilizers between your spine. You're like, oh man, I feel more upright. I can feel when I slouch, and I can then use my muscles to make myself upright. Instead of you feeling sore, you start noticing, oh, that's pretty cool. Your back straightens itself. What's up when you pick something up? Instead of like rounding, when you're picking up like Costco water bottles, you've done the deadlift for like 2 months. You're like, oh, this feels familiar. Let me get my back neutral. Let me get my upper back engaged. Let me hinge my hips back. Now you're lifting this Costco water bottles with ease instead of like straining and like it's hard. You're tight. You start feeling your glute. You start feeling your muscles working. You're getting up from a chair. Like, oh man, I felt my muscles like engage when I got up. Pretty cool when that happens. It's like these little things because your body starts talking to you. It's giving you feedback, right? You said the beginning and the most important thing, it's not your bone and your muscle, it's the fact that your brain and your body starts talking to each other. Your body starts talking to your brain, it's getting feedback. It's giving you positive feedback. Hey, this feels good. This is somehow a positive feeling. Something internally feels right. That's how you know you're making progress. Not 6 weeks later, I don't feel a damn difference. Like, okay, maybe the 2 pound weight is not it's not enough to move the needle. That makes sense? And then it's a pretty cool thing. This the new baseline. The easy things or the things that used to feel hard now feel easy. The things that used to feel a little challenging now feel completely easy. And it's a feel that is only earned after, I'd say, consistent training for 12 to 18 weeks. Every 6 weeks, your muscles will I try to gauge progress, not for people, because it's so hard to see progress day in and day out, week after week. It's so hard to measure progress. But you look back at someone's progress 6 weeks prior, you can really see a difference. And it's not just with the weightlifting, guys. Like some of the funnest videos we do is with some of our elder clients when they're just working on their balance. Like we get footage sometimes of some of these patients. It's the we're so grateful that we are able to use it for you guys just to show the things that were hard, almost impossible. Like the lady with the cane, she's putting her foot on the step. It was hard. She kept doing it. And then you look back 6 weeks in the future, like, oh my gosh, this is easy again. But it's still challenging enough where she's still getting benefit from it. And then you do the 12 week. So, oh my gosh, now you can see the progress. You can literally see it week to week, day after day. You may not be able to notice it. And some weeks were worse than others. Like maybe like week 3 was better than week 7. That happens. But the effort keeps putting in, the physiology changes, the neurophysiology changes, the muscle physiology changes, and then at some point the bone physiology will start to change. So don't track your progress day to day. Maybe about 6 weeks is a good way to kind of analyze, especially as you're starting out, to do an audit of how do I actually feel? Do I feel different? Do I feel the same? Do I feel more achy? Won't know until you start to do it. But give yourself about 6 weeks to be able to measure your progress, because that's how long it usually takes to get your first compounding cycle. Some people at 12 to 18 weeks. It just depends. It just depends, right? Measuring progress. Just think about it. Pay attention to it. You'll start getting feedback from your body if you start paying attention to it. Most people don't. They're just doing exercise. 6 week rule, just talked about that. The what the hell effect. What the hell effect? This is directly from Pavel Satsulin. We'll do like emails. We'll teach you. We'll show you guys these resources where I get some of this information from. What the hell effect is when you've kind of hit that first compounding effect curve where you're like, you just look back like, what the hell is this? Again, progress is not one big leap. It's 100 small little things that compound over time. Then one day you just pick up a suitcase. You're not even thinking about it because you've done deadlifts and farmers carries for about 8 weeks, and you're just like, oh, 30-pound suitcase. I can just do that now because I've practiced it for like 8 weeks. Or you're gardening for 2 hours and your back never says a word because you've got endurance in your spinal stabilizers, you've got mobility in your hips, you've been practicing a deep squat, your hip stabilizers know how to activate, you have endurance. Those things won't build up, but you'll start noticing it in day-to-day life. One lady before, she was like, a long time ago, she'd tell us like she'd go watch like her grandkids like football games, and she dreaded going up the bleachers, just dreaded it. People are watching her. She's like limping, her knee hurts. And then like, 8 weeks later, she's just flying up the stairs, not even thinking about it. Like, what the hell is this? So what the hell effect? You don't notice it day to day. You're doing your leg raises, your little bridges for the first month, but like this is how you know you're making progress. You start noticing things changing your daily life. And if they're not, have to evaluate, are you at the wrong level? Are you taking it too easy? Or if you feel thrashed and just sore and achy all the time, that's how you know you're probably swimming in the red and orange. All right. You should not feel this. There's a sense of urgency that people have. I feel the weight of it, this new diagnosis. People feel this need to have to do something now. They have to jump in. But the people that are doing it, they're doing it well. They're staying in the game. It doesn't feel urgent. They know that there's work to be done. They're just layering in their form. They're layering in their technique. We are acutely aware that we're fighting against atrophy, but we are also prioritizing to make sure they do not get hurt in their training because that's going to wipe them out before. I'd rather underdo it and just to know where someone's level is at instead of for the sake of like rushing into bringing them into the program because they're losing their bone score. They'll be rushed too heavy. They hurt a disc. They, God forbid, fracture a vertebrae, develop plantar fasciitis. You get plantar fasciitis doing your heel drops week 3. You're not going to, I'm telling you guys, you're not going to be able to train for like 6 months, 6, 9 months. get a bone spur in your heel. There's no way. Week one, heel drops. There's like I don't want to keep harping on it. I understand the physiology and I understand why people say it. And I don't want to just keep bashing on that. But I'm not doing those week one, day one with someone just starting out. I have no idea what their baseline is. They haven't exercised in a while. We develop plantar fasciitis. That's a for us, that's a client gone. And two, that's just like 9 months for some people. You guys understand that? So we have to think about if I'm going to do this exercise I'm seeing on social media, what relative level is this exercise to where I am right now? Some people it's really good and it's a good exercise. It's bone stimulating. We're going to go over it. I don't have anything against the exercise. I have something that people don't understand the level of like joint health and tendon health and strength that they need to deal to do that without developing plantar fasciitis or a stress fracture in their foot or like knee pain, like a calf tightness. It's fine exercise. So if you don't know where it fits with regards to like your current level, it could be bad. Got to build a routine. This is a routine, guys. This is like brushing your teeth. This is like, taking a shower. This is not something you just do one off. This is something that if you're going to do this, it's not going to be a one-off workout once a month. It's just not going to work. Twice a week, 3 times a week. It is just what it is. To track what you're doing, pay attention to your body. Are you making progress? Even small progress, you keep going. Expect plateaus. Or our clients, Pam, the lady, like we stayed at like a 35-pound weight for probably like 4 months. 4 months we stayed at the same weight. All right. Didn't need to go ahead. We were there was no urgency. The reason why I worked for her, we weren't under this pressure that we had to change her bone score in like 8 months. Just got to feel it out. Just have her just earn a level. Just stay there for a couple months. Let those adaptations really settle. Let them sink. It's okay to stay at a level as long as you're still being challenged, as long as you still feel good, as long as you're still feeling motivated because you're still making progress. And there are times when we work with clients where it's like, why do you keep coming? I'm doing the same thing. I'm not doing anything new. It's like fair enough, right? Are we stagnating? Are we playing it too safe? That's possible too. I'd rather stay the state. I'd rather stay safe than go too risky. That's just my personality. For what we see, like we just don't want people getting injured. If people want more variety, want to go more intense, and they can find someone to do that. You have permission to be patient. Your bones didn't get weak in a month, they won't get strong in one either. 3 months from now, you'll feel different. 6 months, you'll start to feel it. You'll see it. A year might be undeniable. Just show up 80% of the time. 80-20 rule, guys. Just show up for 80% of your workouts. Don't get hurt. Make sure you're pushing yourself just enough. The compound effect will just do the rest. This is the key. The consistency is so more important than the workout, is doing the workout at a level that you need to make progress. Remember the lady before? Same back. Instead of sitting, picks up a weight, doing a farmer's carry, going up a step, upper back, able to lift something up, lifting suitcases up the stairs. Which path do you guys want? Decline curve or the upswing curve? Which curve do you guys want? All right. What do we want to do, guys? We want to do nothing? Or do you want to just play the slow, consistent game of just consistent progress? This is how it will happen. There's no other way. Plan for 18 months of commitment. All right. Time for the exercises, guys. Holy crap. How many hours are we at? 10, 11, 10, 11, 12. 3 hours? Haven't even done exercise yet? Holy crap. I knew this was going to be long. Short break. Can I take a short break? Are people still with me? 3 hours in, three plus hours in. People are still with me. Are you serious? Can I take like a 5 minute break? Will I lose people if I take a short break? Please don't go. It's easier when we do it live with people. I'm much more energetic than when I try to do it to a blank screen. Reason being, I couldn't fit all the exercise on the same slideshow, and I couldn't finish all the slides because there's too many slides. I've created a lot of slides. We did a lot of slides today. Guys, this stuff is way more important than the exercise themselves. The exercise are important. That's the tactical stuff. We're gonna go over it. But if you take nothing away, just rewatch these principles. This is what will guide you. I promise you. We'll be back. Great. More exercise.
We're supposed to look this week. Didn't know this one was right now.
Yeah. Yeah. Hey, Ray, we're back. Let's introduce everyone to some people behind the scenes. Teddy. Teddy's here, nearest tree,
Hi, thanks for being here.
behind the scenes. All right. These are our the support literally in the room behind us, make sure everything's going smoothly. So we very much appreciate people being here with us. A lot of people still here with us, almost 4 hours in, and we're just getting started, guys. You guys got energy left. All this will be on YouTube. You won't miss anything. Anything you see here, you don't have to remember. You don't have to remember everything. Maybe you took some notes, which will be helpful, but we're going to make this accessible to everyone. I hope it's still recording. It's still recording. All right. So the slides for the exercise were too big to get in this webinar, so I just need to on this slide deck. So I need to just go in and out of some slide decks here. Okay. So just give me a second to. Are we ready to continue? Oh, I just need to check something here. Okay. Movement patterns. Now we start to talk about the exercises. And every single exercise has a different spectrum of difficulty. All right. So we're going to go over each one. Now, I couldn't finish all of them, guys. So please forgive me. I didn't finish all of the exercises. We did this all within a couple of weeks. Okay. So we're going to go over the important ones, but we didn't finish all of them. So please forgive us. We're going to go over the important ones and we'll do more. We'll go over all of them later on. We won't be able to finish everything today. All right. So let's talk about the squat. There are spectrums of difficulty for each of the exercises, and you see them on social media, guys. You see our clients doing various versions of these exercises at different points, but it's all the same pattern. The squat starts with a child's pose. Why? Because we want to make sure our first principle? Move well before move often. If you're going to do a squat, your knees need to flex, your hips need to flex, your spine needs to move. If you're going to do an overhead squat, back squat, your shoulders need to move. Every exercise is gauged off of the wheel, the stat wheel. Remember? Principle 3? This is a mobility exercise. Don't need a lot of motor control. It's not very difficult. You don't need a lot of agility. There's no strength. Maybe some stability because we want to teach you to keep your back straight. Each exercise we want to gauge in terms of the relative risk to the person. This again, I want to be clear. Relative risk. Sometimes people have like knee arthritis. This may not be the one for you, but just in general, in terms of like just general riskiness, right? It's low risk. Bone impact, probably not so much. We're not getting any stronger bones from a movement like this, but it's our starting point. How do you do it? Starting hands and knees. So your hips to your heels. Try to keep your back straight. Because you're gonna want to keep your back straight when you load a squat. You don't want to remember, you don't want to round it back when you do a squat, especially a loaded squat. You want to be able to keep your back straight. All right. Breathe in to the movement. Don't just force it. Get knee issues. Well, it's a good thing we've identified your knee issues here before we did it on a loaded squat, right? If you have hip tightness, if you can't keep your back straight, if your back keeps rounding, if your shoulders and your lats feel really restricted. This is why we do this first before we do anything else. Just to check to see, can the person, again, can their joints get into the right positions to absorb and react to stress? Are the muscles long enough to allow their joints to get into the position? Can they hold a very simple position on all fours before they're asked to do so with a barbell on their back? Make sense? This is not a bad child's pose for yoga. Again, I'm of the camp where healthy flexion is good. So this is not a mistake in which this is going to cause problems. It's just for the sake of the child's pose with respect to helping you train your squat movement pattern to prime you for it. We do want to just make sure that you're able to keep your back in some form of alignment. This is a fine stretch for yoga, for spine health, for hip health. Again, case specific. I don't want to get any trouble from people saying, "Oh, you're telling me to round my back for osteoporosis. You're bad." Please don't come after me. This some people it may be bad for, so please don't take this the wrong way. But this is as basic of a stretch you're ever going to get. And I haven't really caused, in 15 years of practice treating bad backs, I haven't really flared someone up or caused a fracture just having to do a gentle child's pose. Right? But with respect to a squat, a loaded squat, straight back. Sometimes, and if your heels can touch your butt, you got some knee problems, some quad problems. Maybe we just need to acknowledge these before we start to do goblet squats, back squats, jump squats. Learn it here before you are forced to learn it with knee pain afterwards. I didn't get all the clips in, guys. Some of them have clips, some of them don't. We'll be filling in the gaps at some point. I couldn't get it all done, so my apologies. Sit stand. Level 1. So this was level 0, foundation. Level 1, restorative. Teaches a basic squat pattern using a chair for control and confidence. Builds the exact strength used to get up from a seat, a car from the floor. Helps rebuild some trust in the knees and the hips before removing any support. Not a lot of mobility requirements, some motor control, some stability, get some strength. Relative risk, not much. Bone impact, not much, a little bit. You're getting some contraction, but gotta start somewhere. All right, how to do it? Sit tall, keep your shins close to vertical, hinge forward just a little bit at the hips before rising, drive through your whole foot to stand, keep knees tracked over your toes, not caving in, and just slowly tap your butt on the chair and then pop back up. Don't just sit there and just plop. Control your descent, touch, and stand up. Things to watch out for: knees caving in, looking down in your posture, slump forward, look straight, look up, drive up. See how her back is rounded? Right? We want to teach people how to use these posture muscles. And you do that by looking up and driving your vision up. If you drive your vision up, that'll drive activation through your posture muscles. Look down, your center of gravity will go towards the floor. We don't want you to do that. Look straight, look up, chest up, posture up. Don't look down. Don't let your knees cave in. Carol, let me know if the volume's too loud. I don't know how this is going to play out. And let me know how video quality is. Week 16. Knee caving a little bit. Sit stand. It's easy for her now. Her first sit stand was very hard. 4 months of doing the same exercise, just popping right up. So cool. All right. That's what that looks like. Level 2, beginner. Remove the chair, but we still have an anchor for some support. Builds confidence teaching people through a full range of motion under control. It bridges the gap between assisted and fully independent squatting. A little more risk than just a child's pose, because you're going to put some stress on some ankles and some knees. You're going to be challenging a range of motion you haven't done before. But in terms of like causing a fracture, it's like no, it's not so bad. But this is a pretty, I'd say, a pretty safe exercise. Again, context dependent. Some people have got really bad knees. I'm just trying to speak to the general population that this might be hard for some, but it's lower on the spectrum. It's way better to start with these than doing a back squat. Bone impact, again, not so much, but we're building that foundation. Need quite a bit of mobility because we're training you to go deep. You need some control. Got to keep your back straight. Got to keep your knees out. Got to keep your hips dialed in. You got to maintain some level of stability through your core and your trunk. We don't want you just rounding forward. Don't need a ton of strength, and again, not a very foot fast, dexterous, agile movement. Start standing. Hold onto the straps, feet about shoulder width apart. Sit your hips down and back, using the straps for balance only. Keep chest tall and weight through like the middle of your foot. You don't want to kind of sit, lean all the way back. You don't want to be too far on your tiptoes to the point where your heel is coming off. Middle of your foot, maybe a little onto your heel, but not all the way back. And press through your heels to stand up to make sure you're driving through your glutes and through your hamstrings, through your core, not just all pressure through your quads and through your knees. Same issues. Watch the knees caving in. And make sure you don't do this. This is a good stretch, to be honest. Like we have a lot of people with like back pain. Their backs are like really extended. And we have a lot of people just do this stretch and it feels really good and it feels really nice. Stretches the lats, opens up the spine a little bit, especially if their muscles are really tight. They've got like stenosis. It really kind of opens up those vertebrae. So again, I get that. I get the fact that people are worried about flexion. And again, for some people, as I said, got to be careful. That's absolutely not my intention. Is to say all flexion is good and all flexion is bad. I'm saying like this for a lot of people, this is a kind of a good feels good stretch. Their back feels like some relief. They're getting their hips down to the sockets. It's just for the sake of teaching somebody like how to do a proper like squat with a nice neutral spine deep into the hip sockets. We don't want people to do this to prepare for a squat, but this might be a nice little warm up, a nice little stretch for some people in some contexts, in some situations. Okay. "77 years old, first session." It's not about age. She has the mobility. She was too forward, so she was leaning back, or the ropes were pulling her forward a little bit. That motion, that range of motion. It's not age. She has the mobility. She has the stability, motor control, just doesn't have the strength, and that's okay. So we're starting her here. Not like most 77-year-olds, tell you that much. This is what this looks like. Breathing on the way up. Pelvic floor issues can happen. Got to make sure we brace the core, get that transverse abdominis in. Exhale. Push your air out. Engages your diaphragm, engages your transverse abdominis. You don't want to create like what's called the Valsalva maneuver, which creates pressure downwards, and you call it like pelvic floor prolapse. Don't want anything like that to happen. Breathing, essential and vital. Better to learn it assisted than to have to learn it doing a goblet squat or doing a back squat if you're just starting out. Start something like this. Make sure your knees don't hurt. Make sure you can get your hips into the right position. Make sure you can brace your core, get your back straight, and just familiarize yourself with the motion before you start to go heavy. Is that clear? Heels elevated body weight squat. All right, you see guys see where I'm going with this, right? I'm not sure if we're going to do a deep breakdown for every single exercise, right? We'll probably do it again because there's so much more we're going to get to. At some point, I do have to go home. It's just taking longer than I expected, but I want to get through some of the important things. I like the heel wedges. It shifts your center of gravity a little bit forward. It helps people with ankle mobility problems. And it's just one of these really cool tools that allows people to access a deeper level of squat than they wouldn't have been able to on their own. I'm going to do more slides on this. I did a chance to put them in, but in my opinion, it's the squat depth is what's going to trigger more femoral load than a half squat. You see a lot of people doing squats. They come in, they say they're doing squats. We see the squat, they're going like at 30% of the way down. They're just bending their knees and just sitting their butt a little bit. The deeper the squat, the greater the load, more tension on the muscles. More tension on the muscles, the more compression you'll get into the hip socket, signal more bone. The heel lifts help facilitate that without really compromising significant form or technique, in my opinion. It's a great training tool. At some point, we'd like to advance people out of the heel lifts, but it's a really good way to be able to eventually train the ability for you to explore the depths of your hip sockets. Back stays straight, arms out for a little counterbalance, sitting deep into the hips, everything in nice angles. It's not rounded forward. Knees aren't caving in, not rounding your back. It's pretty good if you're like roasting a marshmallow. For like one of these like the Asian people in like Vietnam, like playing like dice or something like that on the street. They do this all day long. Not something we want to do with load, but yeah, hope you guys get what I'm saying. Pam, this is before we trained her to do the deep goblets. We were practicing with these. She's leaning forward a little bit, just learning the movement, getting used to it. All right, couple questions coming in. I'm going to answer some questions before I just keep going on. Yeah, Amazon. I'll post the link, guys. I'll email you guys the link. I don't want to spend too much time finding the link for you guys. Just um yeah, I'll make sure you guys get the link somehow, some way. I don't want to dig through the link right now, but front-loaded goblets. Now we're talking. Now we're starting to add some load. Once you've earned the right to do that squat, pain-free, full depth, feels good, no pain. Now we start to entertain the idea of adding some load. Single goblets probably first before we do double goblets, but you know, I didn't want to, they're kind of the same exercise. I'd say again, don't take these scores. I'm up for debate. I am these are not this is just how I think. Medium, medium high, depending on the weight, depending on the weight and the load. The heavier the weight you go, it could be much higher than a 5 pound weight. So there's variability with bone impact. So please don't call me out on things like that. I'm just trying to give some people some type of relevant like context for how to think about, am I doing like chair squats? Is that enough to stimulate my bone? No, it's not enough. Front loaded goblet squat. Now I think we're starting to get somewhere. Risk. Yeah, we're starting to enter some risk. There's some weights, there's some pressure on your shoulders, there's going to be some load on your spine. You're gonna be putting some pressure on your knees. This is not for the faint of heart. This is definitely not for someone just completely starting out. Although we've had some people just come in recent weeks. We got them doing a full depth goblet day one, and they haven't squatted deeper than like 30% in their first squat because we took them through the progression and we just tried it and they were able to earn it. They were able to do it. It might take a couple weeks for them to solidify those gains, but the fact that they could do this depth of squat day one and had no idea that they could, some pretty cool stuff. So we don't just stay at certain levels just to stay at them. If our judgment shows us that they have enough mobility, they have enough control, they have enough stability, they can get into the right alignment, let's go. Like we don't want to just be doing sit stands for 5 years. We want to challenge people right up to their limit. And so we try to figure out where people's levels are like as soon as possible so we can just make sure we're at those right zones. Lots of mobility demands, knee, hip, shoulder, spine mobility. You got to really have really flexible upper back, or else your back will start to cave in. Definitely need some motor control, stability. Not the most agile thing, but you do need some kind of loose hips and loose ankles, so there's some agility there. All right. Self-explanatory. Do want this? Do want this? I couldn't generate the image of the heels coming up. Sorry, guys. Couldn't finish everything. I did my best. The iconic double goblet squat. Bam. The range of motion she's got. Control, stability. It's hard. It ain't easy. There we go. Nice job. That's what that looks like. Each of those are tens. Would someone with knee arthritis ever be able to do a double goblet squat? I don't know, guys. I don't know. Hard to say. Really hard to say. Okay? Hard to say. That's why we have other exercise. That's why we have modifications. That's why we have progressions and regressions. That's why these are not across the board the only exercises. People have a lot of people have knee issues. We don't have them doing this. There's no way. Uh-uh. Nowhere close. The ones that have the mobility, of course, we're going to do it. But for those that don't, we'll find another way around it. Reason for the wedges, just makes it easier to sit deep into the hip sockets. I don't fully know. It's just one of these tricks that we learned. And it again, it helps people that have stiff ankles. It helps reduce ankle range of motion required. And it shifts the center of gravity a little bit to allow people to sit deeper into the squat. I think it's because it shifts the weight a little bit forward, so the weight naturally sits into the glutes a little bit easier. Okay. Levels, guys. There's levels to this. I'm gonna be very clear, guys. Our clinic does not have barbells. We just do kettlebells only. We're just showing it because this is part of the research. I'm not against them. I just don't really swim at these high levels for a lot of our clients. We'll get it back. We'll get a Olympic barbell. Like I'm not opposed to that. We're going to be getting one when we expand the clinic a little bit. I'm not opposed to these things. I think they're valuable. They can be good. Over the years, I've just always preferred front-loaded double goblet. I've always preferred goblet squats. They feel better. There's this really nice when you do the goblet squat. There's this really nice what we call like reflexive activation of your core and your abdomen. It just braces your whole core and your trunk. The back squats can, especially if you guys, if you don't really know what you're doing, if you don't have good thoracic mobility, if you don't have good awareness, like please do not start here. This is high impact, but there's definitely some risk. Obviously, relative to the weight that you're doing, it's gonna be a lot harder for people to go deeper into the squat with the bar in your back trying to pull you backwards, right? But it's going to be a little bit easier to push the weight up because the weight's going to be aligned right over your center of gravity. So people are generally able to squat more with the squat in their back. But there's a lot more back extension load. There's just a lot more going on that uh that's not what we do at this clinic. But I'm not opposed. I see people doing it. They're just staying again where we're at for our clinic. Liftmore does these, right? I'll kind of get through these a little faster. Again, you guys want to make sure you're not overloading the extended spine, create that back extension that we want, knees caving in, the standard cues. And then there's the jump squat with like a weighted vest, right? This is at the high end extreme, guys. We just want, this is higher level stuff. A lot of our stuff kind of plays within that like orange and yellow to orange zone. We don't do a ton of this stuff. It's out there. People are doing it. I'm just telling you, like we're like a pain rehab clinic first. We don't do a lot of this. We don't have a lot of videos of extreme jumping and stuff. Just so people are aware, we just want to let people know that it exists. Okay. And that you should better like be able to do all the things prior before you just literally jump into doing things like this without any checks and balances, agility, strength, stability, bone impact. Like I am not trying to diminish the impact that something like this will have on your bones, but if an injury happens before you get to your bone health, because we didn't have a set of checks and balances to make sure you can do a T-Rex squat, you can do a full depth squat, you can do a goblet with control, with depth, with ability to absorb and react to stress. Let's do that before we do this. That's all I'm trying to say. All right, we'll take a couple questions for squat, and then we have a couple more that we're going to go over. Who's still with me? Who is still with us? All right. Anyone still with us? We're at like what? How many hours are we on now? Holy crap! This is going long. I knew this was going to go long, but thank you all for staying with us. This really means a lot. We wouldn't do this without people doing this live with us. Any questions about the squat? Any clarifications? Does it make sense? everything we built up to this point, levels, stability, mobility, balance, control. Do you all see how everything's integrated? You don't just do these exercises. You check to see what level you're at. Right? There's a progression of every exercise. Sets and reps, 5. 5 is the magic number. 5 is the magic number. You do 5 squats, you don't feel a thing. Maybe it's time to increase the challenge, but this is, again, these are clinical decisions. I'm just sharing our framework. This is not a prescription of what to do on your own. Please, I want to be clear about that. Right? I want to be very clear. This is not broad advice for you guys. This is how we do things here. This is not a prescription to do this on your own. You can try. I'd rather you do something with some thought into it, but I cannot prescribe someone to do these if they have knee arthritis, if you got ankle stiffness. I can't say do these without, because we do like tests, we do assessments to clear people before we do these things. We don't just do them arbitrarily. I just felt that it's necessary to give people some framework to start to do these things without literally just walking to the gym, start doing things without having understanding of how to get here. That is squat. Any other questions for squat? Where's hinge? Okay. Hinge spectrum. Foundational groundwork. We start on the ground. Everything we do starts on the ground. Checks and balances is the same movement from when you're standing. Starts at the bridge, dowel, elevated 5-pound weight, single kettlebell, double kettlebells, maybe a barbell somewhere, a swing, and a broad jump. These are not fixed along the spectrum. You could do a heavier weight elevated if you don't have the ability to touch your toes. A light swing might be less intense than a heavy bell. Right? So these are not fixed. This is just relative points for people just to think about intensity zones and the requirements and prerequisites to be able to do these things. The higher you go, the more bang for your buck, but the more risk. You better earn these levels before you get up to here. Starts with the bridge. All right. We're not getting a lot out of here. We're just building a foundation of neurological connectivity to the muscles and the patterns that we need to make sure that we are ready and we are safe to get to the next level. Teaches hip drive and glute activation without any spinal load. Good starting point. Builds a foundational hip hinge pattern laying down where balance and stability isn't really an issue. This is an entry point for literally everyone. Right? No prerequisites, no equipment. If you can't do a glute bridge, then well, let's stay at this level until you can do a glute bridge. We have a lot of people, bad backs, stenosis, arthritis, can't stand up straight, hunched forward, and they struggle with the glute bridge. We do not trivialize this exercise. And getting them to a point where they can do a glute bridge, it's literally life-changing, where a person can then stand for 5 minutes instead of just give out after 30 seconds. So these foundation exercises are no joke. They teach you a lot about your body, especially if you're just starting out. Or even if you have been lifting, just do these the right way. You'll feel something. Your body will start talking to you in a good way. Lie on your back, knees bent, feet flat, hip width apart. Feet planted in a comfortable position, distance from the glutes, not too close, not too far. Drive through the heels, squeeze your glutes as tight as you can, but keep your back flat. Don't let your back arch. Lift through the hips, but not by arching your back. Lower back to the floor with control, and keep your abs on too. Tightening your abs before you lift will help make sure you don't arch from your back. Like this. This is not a bridge. That's a back bend. That's no glute, that's all spine. That's not how you do a bridge. A lot of people, this happens to so many people. Sometimes their knees are, that's not what the point I want to make, their feet being too close. The fact is, like, their hamstrings cramp, or they feel this enormous stretch in their thighs because their quads are very tight. They can't even feel their glutes because their hamstrings start cramping. That's because their hamstrings are working against tight quads and the glutes are just sleepy. So the hamstrings are then doing the work of the knee and the work of the hips, so they cramp. Very common sign for a lot of people that need to be doing glute bridges before they start doing deadlifts. If your hamstrings cramp, there are some issues that need to be sorted out in this movement pattern before you start doing so standing. Right? I cannot have the time to go too deep on some of these other stuff. This will probably be another webinar in the future where we start talking about just like weird like quirks of the body, like common mobility problems, how to fix these more like pain and rehab type of stuff. If people are interested, we can spend a lot more time going over some of this type of stuff. I don't want to show a bridge. I don't have one. You guys get the point, right? All right. Dial hip hinge. We have a lot to get through. Your first hinge, slide the dowel down your back, keep your back straight. Just got a little arching. All right. I couldn't get all these generate images to do exactly what we wanted to. We just want this a little flatter from here to here, but close enough. Hip hinge, forward back, chest up, chin tucked. I don't like the chin forward, the eyes too forward. I like the neck a little bit more neutral. I'm okay with it for some people. People that have neck pain probably don't want to be like putting pressure in the back of their neck, but it's going to teach you the pattern that you are going to build off of. Some people like doing it with a dowel on their spine. I like doing that as well to coach neutral spine, right? One point of contact in the head, one point of contact at the back, one point of contact into the butt. You need a little bit of shoulder mobility to do that, but this is the basic level one hinge with no weight. Slide the dowel down your thighs, bring it to your knees, stand up, squeeze your glutes, push your hips forward, tighten your abs. You're just doing a bridge standing. It's the same movement. You got to feel your glutes tightening. You got to feel your abs bracing. You do not want to arch your back standing at the top. You'll compress your vertebrae. You'll tighten your muscles. You don't want to be hyperextended. Don't want to round too far forward, right? This, again, not for the sake of doing loaded exercise, right? If you want to tie your shoes, case dependent. I don't want to go on that rant again. But when we're loading, we don't want to teach rounded spine while loading. We sometimes teach people start in flexion and then teach them how to get into extension because that teaches them how to stabilize and create stability throughout their spine. You don't want to squat your deadlift. This is a very common mistake. People bend their knees. They're squatting, like in the past pattern. Hips need to be back and up. We want to drive tension through the glutes and through the hamstrings, not through the knees and through the quads. Big difference between the two. We'll do more on this later. Barbara, she's here for back pain rehab, not here for osteoporosis. She's made a lot of progress, guys. She's one of our very fortunate we could share this stuff with you guys. This is her first one she did. The first one. Feels good. She said it feels good. It's training the movement pattern. Great job. That's what that looks like. Ah, oh, crap, I lost it. The infamous elevated 5-pound weight exercise. This is a nice starting point for a lot of people. It teaches you guys all of the strength of the skill, the neural feedback, getting your body into the right position with a little bit of load. We elevate the step just to be on the safe side, to just elevate people so they're not fully rounding into flexion. We elevate it pretty high up just to see, can you maintain a straight back with your hips back driving tension through your hamstrings and just keeping everything locked and engaged. This is, I think, a really good starting point for a lot of people. And I don't think you're going to put yourself at significant risk unless you're just completely rounding your back and just, just loading it with no intent to get your muscles activated, okay? Right? We want to be cautious, but we want to just understand what keeps things safe. Straight back, neutral spine, no extension, no flexion, completely straight. You're safe. You're good. Brace your muscles. Learn how to create stability in between each vertebrae. Harder than it looks. The lift is meaningless. The setup is what's hard. We did this one on Instagram and people got pissed at us because I didn't lift the weight because I was just teaching the setup. People literally started like saying that I'm never gonna watch you again. This why didn't you lift the weight? This one like triggered people because it's about the setup. It's not about the lift. The lift is meaningless. The lift is just there just to teach you that you're gonna hold on to something. You have a target to reach for. You're holding on to something. It's not nothing, but it's all about the setup. The setup is what we're trying to teach people in this exercise. All right. Yeah, I got a little funky here, so this yeah, all right, I did my best, guys. It gets the point across. Grab onto the weight, back straight, hips back, knees out, right? Drive through the hips, drive through the heels, keep your back straight all the way up. Tense your glutes, tense your abs, get your back as flat as possible. Curve is natural, but push those hips forward a little more, tighten those abs, make sure that thing is as flat as possible. You're going to be in a very safe position. A lot of core bracing, a lot of hip work. It's very hard to just stand up straight using the right muscles, right? But you want to be make sure you're contracting muscle, you're bracing, and not just letting the weight just kind of pull you into different positions that you're not in any control of, right? Do not round the back. Make sure the weight is not too far away from you. You want to bring your body right up to the weight, right between your shins, right between your feet, as close to your base of support as possible. Learn to hinge, back straight, chest up, shoulders down, lats engaged. Let me find one. Let me see. Channel. Let's go here. I don't want to dig through. Let's see. We'll find some later. I couldn't sync up all these guys. I'm sorry. If I have them, then I have them. All right, these things will start to get a little bit repetitive, so I don't want to just go through all of them. Same stuff, guys. Single kettlebell, the same principles. All right. More exercise, I want to go over. It's the same movement, it's just with a heavier weight from the floor. Same principles. Make sure it's not too far away. Make sure your back isn't rounded. Make sure you're not squatting the lift. Here's Twee demonstrating the single. Back straight, hips back, tall, tight glutes, tense abs, completely straight, shoulders back, posture up, back straight the entire time, hips hinging back, nice and slow, nice and controlled. One more time, drive through the heels. She sits a little bit just to make sure she's not rounded. Back completely flat and straight. Shoulders down, locking those lats in, driving through the glutes, squeeze the glutes at the top, tighten those abs, back flat, shoulders back, standing tall. Hips back, chest up, back straight. That's what that looks like. The double, same thing. It's the same thing. Don't round. Don't jerk the weights up. Very important. We'll teach it when we go through the demo. Julie, stronger than me. All right. Look at the setup. Back straight, hips back, knees out, Little tucking the chin, but it's okay. She's getting a lot of that neural drive through her thoracic extensors. Most important thing is she doesn't jerk the weight up. She's making her torso long, extending her spine, right? I want you guys to think about this little cord here. Think of if like your car was like stuck in a ditch somewhere. You have this like rope you have to like anchor onto your car. All right. So pretend like my hand here is what I'm trying to pull out. I don't want to have like a loose rope and then pull. I want to take all the slack out of that rope. Make sure there's a lot of tension and then slowly pull the weight. So when we are doing a deadlift, we do not want to go from loose, light shoulders into one jerk and then pull. That's way too much. You're trying to overcome inertia. That point at which you're trying to jerk can create excessive strain on tendons and tissues and muscles. And if you're not prepared for it, that's where these little injuries can happen. Nice, long, slow pull, and then it just comes. All right. Another angle. Oh, wait, we didn't even watch Julie. Boom. Locks in those lats. Stability through the shoulder, through the back. Nice. Keeps the same position every rep. Getting tiring. She does not lose form. It's the same movement. It's the same joint angle, same muscle contraction. We're paying attention, make sure she's not fatiguing, make sure she's not losing that alignment. 100 pounds, guys. This is not nothing. This is a pretty decent amount of weight. She got 10. Nice. 100 pounds, 50 pounds each hand, 10 reps. Strong. Pam? 70 pounds. She's not jerking weight up. Just goes up. That's why again, we'll check with the actual experts to see what they think about head forward, chin tucked. I think it's a worthwhile for debate, right? When you get that chest up, the head naturally drives up to get your vision, and that creates that little bit of thoracic extension, which really helps that last little bit of just, taking the slack out of the shoulders and helping create a nice little pull. Sometimes when you're too relaxed down there, you try to jerk the weight up. That's not something that we want to do either. Swing. Swing is the deadlift. It's the same movement. It's the same exact movement pattern. You go from here to here. You just do so with repetition, swinging a weight. Why these are so beneficial is because not everyone's going to have access to a barbell with Olympic style weights, but you can have a kettlebell at home. Not advise people to do it without, again, control and clearance. Again, this is just our program. Please don't take this the wrong way. Don't take this out of context. We don't recommend people swinging kettlebells unless you've got to have clearance, okay? I always have to make sure. A 25-pound weight swinging, you're not just lifting a 25-pound weight because of this thing called Newton's law. Force equals ma. The weight is accelerating with gravity. So you literally get exponential increases in the amount of ground reaction forces that you're generating through your torso with an accelerated weight. This one is going to drive, I'm pretty certain. Again, we can talk to biomechanics experts, the actual experts that research these things. We'll try to find them for you guys. Don't take it from me. This is just what I've read from them. This thing's going to drive some insane force and load through your spine. If you keep your form is going to really help drive a lot of stimulation through the spine and through the femur. High bone score, high risk. We talked about that flexion-based injury before. If you are not strong and in control of your glutes and your core and your spine, and if you lose control of this weight as it's pulling you back and forth, we get comments on Instagram said some ladies like, yeah, I did these, I fractured 3 vertebrae. Like, yeah, fair enough. Risks are real. Doesn't mean that we don't do them. Just means we need to understand the context and how these things happen, make sure we protect against that. They can be safe if you do them right. And they actually kind of feel good. This is one of these exercises that, man, if you nail this, your body feels really good. It does not feel sore. It does not feel beaten. You do not feel all this like achiness. You get so much out of it. You get cardio, you get power, you get explosiveness, you get stability, you train all the things, you get a lot of bone loading. More accessible than a barbell for a lot of people. There's just a higher technical degree of difficulty in execution. It's the deadlift. It's the same position. You're just swinging the weight like a long snapper in football. You're hiking the weight back behind your legs. Hike, throw it back behind you with force. Keep that back completely flat and straight. You stand up, drive those hips forward. Tighten your abs. Make sure you're not arching your back when you stand up. The weight does not need to go high up. Around just chest height is completely fine. They call it taming the arc. You want to control this arc of movement. Talk about motor control. You're in control of the weight. The weight's not in control of you. Right? High technical difficulty, high rewards. Don't squat the weight. Don't let the back arch backwards. It cut off the hands going up. Don't make sure the hands don't go too high up your head too. Julie again. 40 pounds, 40 pounds. Exhale. Sharp exhale. Like a karate. Yeah. Maintains form each time. 11, 12, 13, 14, 15, 16, 17. Training for endurance now. She actually maintained form the whole time. No breaks, in control. We're pushing her thresholds. We're not like this is not nothing, guys. 40-pound weight. It's a lot of weight. Different angle. There. A little rounding. It's okay. Look at the way the weight is. It's back behind her. Boom. Upright, straight, core locked in, glutes locked in. Just a natural little curvature here. There. It's the same rep every time. If at any point we start to see variability with her movement, we'd stop it. She can go heavier, but we're going a little bit lighter for now, just to make sure we're going for more endurance and just maintenance of form. A lot of different ways to progress and regress. Right? Oh my gosh. All right. Broad jump, impact, self-explanatory, right? You were just jumping. Jump up, jump forward, land. It's no skill. You just have to like do it, and you have to get used to it. Right? We all jumped before. It's just for a lot of it's been like a couple of decades since we've done it. Make sure you can do a deadlift and have good joint angle before you start doing these things. Just don't lose your balance. Whoops. Whoopsie. Nailed it. Broad jumps. That's the hinge, guys. Any questions? Any questions? We're gonna go a little bit longer. I'm not gonna be able to get through everything. I've decided that we're not gonna be able to get through everything today, but I wanted to get through at least some of these things. The principles, the framework, the strategy, that was the main intent of this webinar. We will be doing way more exercise breakdowns. Again, we're going for a long time. I don't want you guys to sit with me for too much longer. We will finish this at some point. Okay. Do we want to do one more pattern? Do we want to do a couple more? It's been a long time, guys. But I hope you guys have gotten out of it. I can stay a little bit longer. This has just gone a little bit longer than I anticipated. So let me know where you guys are at. If those for those of you who are still with me, um, is that enough for today, or do you want to do one more? We can do one more. I can do one more. I don't mind. One more. Tanya says one more. Marcia says one more. One more. All right, we want to do one more. We can go more, guys. If you guys want to stay with me, it's been several hours. I can go a little bit more. Two more? Say two more if you guys want to do two more. I probably got two more. I can do two. Let's do one more. We are okay, why not? We'll see. We'll see. We'll see where we end up. We'll see where we end up. Um, Robin says two. All right, we'll do a couple more. We'll do a couple more. We will be doing at some point we are going to be creating the entire exercise library for you guys. Okay. So I go through these things just to get some just to show you guys what it takes. So we can most important you can see the level of the spectrum of sorry, I don't know how to like I'm still like learning like Zoom and stuff. There we go. I just want to see the chat only. All right. Let's go into the next one. Let's just keep going. Let's keep going. Nope. Where is it? Created a lot of slides, guys. You can see the work that we put in, showing you guys this is where is lunge? I just saw it. Is it in here? In here? Hinge, flexion. Why not? Let's just do horizontal push. Does this look interesting to you guys? This one look interesting? The horizontal push-ups. You guys want to learn how to work up to do a push-up? Would that be cool? Starts with the bird dog. Learning the foundation, put some stability through your shoulder, align your trunk. Get a little hip movement out of it too, as well. This hip action is really useful. This isn't the only foundational exercise. This is just one that is relevant for a horizontal push. Dumbbell floor press, easy to do. You don't have to do full body weight. You can just use a small dumbbell. This can interchange with this if you start going to heavier dumbbells, right? There's some interchangeability here, right? But this one, your spine is supported, your spine is flat. You're just really working on shoulder stability and learning how to use the right muscles through here. We have we like the straight arm plank because we like to teach our clients push-ups. I don't really like forearm plank. It's just it's always been a little weird and awkward. Again, for some people with like wrist issues, I could see where you'll still get some value out of like an elbow plank. We just like teaching straight arm plank. It's just always been my preference for many years. This will turn into an elevated incline push-up. Some interchangeability between here. Some days a plank might be moderate. Sometimes an incline push might be, beginner. It just depends on each person. Full push-up and then a bench press. right? This is just a good starting spectrum for people to understand how to progress through these movements. Bird dog, great starting point for almost everyone. Going to teach you core control, anti-rotation without any spinal load. I like to see your spine a little flatter, right? It just couldn't get it to get flatter. Builds the foundational stability. Every push pattern above it depends on entry point for everyone. No prerequisites, no equipment. Risk low, bone impact low. But man, this one is going to teach you some stability. This is going to teach you some motor control. This is going to test your shoulder mobility. This mobility might be actually being a little bit higher. It's going to test shoulder mobility, hip mobility, right? Not, you don't need to be very strong nor very agile to do these. Hands and knees, opposite arm, opposite leg. We want more contraction of the abs here to make this a little flatter. Leg doesn't have to go as high, arm doesn't have to go as high. I value a nice flat back than one that is slight curvature, but it's the best I could do. Want to make sure the hip is not rotating up. Keep your hip flat so the pelvis is level. See how there's a line down here? That's a unneutral pelvis, one that is rotated upwards. Drive that right hip down to keep the pelvis flat. It's going to make your core work. Definitely don't want this. We see a lot of this happening. Remember that extension slide that we showed you with people with like really chronically tight, stiff back extensors, smashing their set joints? If they have like a spondylolisthesis, don't want to be doing that. Pushing that wedge forward. Please keep your spine neutrals, keep your abs engaged. Don't just move your arm and move your arm and leg around back and forth. Have some integrity, control, go slow. Arlene, this lady's great. This lady's awesome. Flat. Boom. Look at that. The leg does not have to go far up. The arm does not have to go far up. We're just training stability. She's 77, but she's got a lot of mobility because she did yoga for many, many years. Because she did yoga, she's got great mobility, but she lacks strength and stability. So that's why she's here to learn how to get stable, learn how to get strong. But she's got mobility for days, which gives her the prerequisite to actually start to do some of this stuff, right? If she didn't have great mobility, we wouldn't be able to do a lot of things. Because she has great mobility, she has good joint health, she has good muscle length, and we're teaching her how to create stability. We're teaching her how to create some strength. That's where she's at. It's not about age, it's about just capability. Slow, controlled. She's not just lowering, she's pulling everything back in. Boom. She's teeter-tottering. She's working. She's not just holding, she's working. It's work. Look at that. Straight. There's no movement. She's not just moving her arms and her spine, just bending and twisting. Stable. She's feeling a little lower back, so we make sure she's bracing that core, make sure she's not overextending through that spine. More stomach. Yeah, there. This is the bird dog. Slow, controlled, stable, no movement. Hold. These are hard. These are not trivial little exercises that you just do. All right. I gotta close some stuff, guys. Too many tabs. All right. Floor press. Did not get the images in. Just ran out of time. Let's go to the video. Arlene again. 8 pounds. She came in. She didn't know that she was just messing with like threes, twos and threes. But she did a 5 with like ease. I was like, I think she can go a little higher. Boom. Elbow stays 90, so her elbow isn't flexing towards her. Her forearm is staying vertical, perpendicular to the mat and perpendicular to the ceiling. She is not letting her neck shrug or her upper trap muscle shrug up. She is packing down through her lat and pushing from her shoulder girdle through here. She's not just lifting the weight up. She is packing her shoulder down through her lat and pushing up straight and pulling it back down. She's not just doing this. She has learned how to contract her muscles through her shoulder stabilizers and pushing slowly in control, feeling it through here. She lost a little bit there, but she can do an 8-pound press, guys. She was doing like 2s and 3s for a long time. It was too easy. We moved her up. Straight arm plank. That's how to do it wrong. No butt up. Lot of stability, a lot of control, not a lot of mobility, decent amount of strength. Risk, I don't know. Maybe a little. Here, it's like wrist, shoulder, bone impact, wrist. Yeah, wrist. I think this should be a little higher for wrist. Trains the wrist and forearm. Very common side fracture site, guys. Don't forget about the wrists. People are obsessed about your femur and your spine. Don't forget about your wrists. Wrists are very important. This is how to do it right. This is how to do it wrong. Also how to do it wrong. I will amend these slides. All right. Again, I couldn't find all of the pictures on time, guys. I ran out of time. A lot of other things that we were prioritizing. So our apologies for not getting all of the videos in. Let's watch Julie do a push-up, full push-up. It's pushing. All right. Most important thing about the push-up is that she is holding the plank first. Right? She is contracting her glutes, she is contracting her abs, and she is trying to get her hips and her shoulders in as straight a line as possible. As she goes down, she's still in that aligned position. Hips, shoulders, core, and trunk in alignment. Her back is not sagging. Everything is staying locked in through the core and through the torso. I got a lot of flack for her elbow position, and it is fine for her. Sometimes people say elbows flaring out at 90 degrees is going to put more strain on the anterior part of your shoulder. Correct. But what she does really well is she is engaging through her entire posterior shoulder girdle here to make sure her shoulder is not popping forward and everything is nice and set and packed. All the strength is being generated through her lat, through her obliques, and through her core. And this is just her preferred way to get down. When her elbow's a little closer, it causes her back to start to arch. So we're prioritizing core, oblique, and just a full body kind of plank stability instead of just kind of just repping out a bunch of push-ups. So for anyone that wants to, challenge the elbow position, these are the reasons why. Her shoulder is fine because she has the ability to control her scapula, keep everything set and controlled. All right, so if anyone wants to talk about things like form, we're more than happy to talk. Just clarifying some things that we get on some of our comments sometimes. Stable. He starts losing it there, all right? It's okay to push a rep here and there. Some compensation will set in. Just be aware of what you're doing. Bench press. Again, we don't have barbell here. Maybe it's something we do in the future, but just be aware of that. Let's go into the chat. Questions? Who's still with us? Is anyone, are you guys still here? Is anyone still here? It's been like 5 hours. Oh, we still got people here. What did you guys think of that? The horizontal push pattern. Was that helpful? Yeah, there's a video for incline push-up. I'm gonna find it. If you guys can just if you guys just want to like hang out, I don't want to go through like slides. If you just want to kind of scroll through some clips, I just want to just go through some exercises just to kind of end it. The slides just are very labor intensive for me, and I just ran out of time to really go through everything I wanted to get through. But the principles, the kind of levels and all the colors, that was the main point that I wanted to teach you guys today. And I hope that it helped. Robin, you're gonna get there. Oh, you're gonna get there. We're looking forward to that too. Might take like 9 or 12 months, but you're gonna get there. Questions first. I'm just gonna cover a couple other exercises, a couple of the important ones, because I did promise we were going to be going over a lot of exercises today, but um yeah, thank you. The slides, the exercises are the tactical piece. Lunge. We can show a lunge. Start with incline. Start with the plank and start with incline push-up. Make sure your wrists and your elbows and your shoulders can handle it first. Let's look for let's dig through our library. Yeah, thanks for being realistic for everyone's ability. That's why we spent like 4 hours talking about ability levels. We do not want people doing things that are beyond their level. We tried to give a framework for how to understand like levels. I hope the framework helped. Spent a lot of thought into explaining that. Incline push-up. Let's watch Barbara again. Look at that. Squeezing glutes and tightening the abs. That's like automatic for her now. She's trained it so often to make sure her back doesn't hurt. She's got like stenosis, so her back does not like extension. Glute squeeze, abs tight, keeps her spine relatively open so her nerves aren't just getting jammed in by her vertebrae. Right? This is her first attempt. This is her first time trying. A little bit of a V and L shape, but that's okay. I can't give advice in general for cervical stenosis. It depends if you can keep the tension away from your neck and keep your neck neutral. You don't want your neck like diving in, all the compression develops back there. Keep your everything locked in, keep the tension away from your traps, keep all the load through your lats and through your chest and through your torso. Keep it away from your neck, keep everything down through here. I will show the I will show you guys the progression charts. I have those. I just don't have all the slides. I can't find the lunge. I had lunge slides. I just can't find it. Not bad. 5 reps. Things will not be perfect first time. This is her second set. Look at that alignment. Look at that. See how the alignment's much different now? A little bit of coaching, a little bit of cueing. We want to teach the alignment, the positioning. Glutes, abs, tilt, boom. See how much flatter she is now? She did not get stronger from rep to rep. What she did was she got more connected from brain to control her muscles from rep to rep. This is the neurological learning of the movement that we talked about in principle two. Look at that. See how there's no more of that L shape? See that? It's working. Look at it. No, no push up on knees. No, 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 no. We do real push-ups. Too much cheating can happen. Too much cheating can happen. Let me try to find the lunge. Oh, okay. Did we find the lunge? Yeah. People want to see the lunge. I'll pull up the lunge, guys. I got time. Ah, I forgot to put the thing. Where is it? Yes, we used AI to generate these images, guys. Pretty cool. A lot of iterations. I'll have to dig for it. I can't I don't want to waste too much time with that. And I am starting to actually run a little bit out of energy a little bit now. So um a couple more exercises. I have time for a couple more exercises. Who's still with me? Anyone want to do like one or two more exercises? And then we can just wrap it up. Anyone have any dire questions or any comments, any feedback? Ah, single leg RDL. Remember the stat wheel, guys? It's not all about strength. You want balance, stability, motor control with bone loading, takes care of your core, takes care of your hamstring, your glute, small hip stabilizers, core stabilizers, spine stabilizers, balance, pound for pound. Anyone that's taking this stuff seriously should learn this one, depending on your level. One of the best. Look at that. Look how deep she gets. Look at that deep hip hinge. Straight back. Pelvis level. Holding it there. She's shaking. It's hard. It's not all about heavy loads, guys. Not all about jumping. Uh, Pam doesn't, she just works out here. She'll do some basic stuff on her own, just some like core stuff. Some of the others, maybe one or two times lighter. Heat or ice for sore muscles. Um, if you just injured yourself, probably ice just to calm it down. If you're more stiff, achy, hard to move, you want to use heat. Hip was too high, so she drove it down. Nice. Single leg RDL. Right. What else we got? Sit stands. Dead bug. Yeah, we should go over the dead bug. Same thing for joints. If you're stiff and achy, heat for circulation to loosen up. If your joint is swollen because you just did a bunch of like gardening or you did a bunch of squats at the gym and your knee's like swollen, you want to ice that. Feels in her abdomen. Dead bug, keep your back as flat as possible. This is one of the most challenging like core stabilization exercises. We're gonna have a full spectrum of core exercise. I was building that out yesterday. I just didn't have enough time to fully execute it, but this is gonna be part of like a core workout. Not just a pattern, but for overall just core stability. This is going to be the foundational for core stability for sure. All of the coordination too. All of these videos, the publicly available ones, guys, are on our YouTube channel, YouTube Shorts. Just go to our YouTube page. You can browse through. You can just watch these at any time. This is available for you guys. YouTube, Balance and Body Restoration, YouTube channel. You guys want to watch these again? Go to our channel. Go to our Shorts page. Watch them there. Watch them in our library. We will organize everything one day into one page that everyone can see. It's going to take a little bit of time, so just give us some time for that. All the raw footage is there for, and anyone who wants to see these again. Maintain stability, coordination, control. That's what we're after. Just the legs for her. Sometimes you go opposite arm, opposite leg. Some people it's hard enough just to hold that position. Some people it's just the arms, right? The most important thing is to flatten that spine, keep that core stable and braced the whole time. Do not let the back lift off the floor. It is very challenging, very hard to do, very hard to control. You build up that core stability on the ground, it's going to carry over into everything you do standing. All right, guys, Q&A. We can take a couple questions. Unless there's something a burning desire that someone must see a pattern. All right. We will do the lunge. I will probably do it on my own. We'll post everything on the YouTube. I have a little bit of tweaking to do on some of the slides before I probably put those on as like standalone YouTube stuff. But thank you all very, very much for showing up and spending all this time with us today. I hope that was helpful. We hope that we were able to deliver on the workshop. Mixed messages, bike riding with osteoporosis. Like who? Like just get in shape. Like what's so bad about like doing cardio? Like this is like this is the I try to people are that's why we said like people are getting obsessed about like bone scores and like oh this exercise is bad, yoga is bad, Pilates is bad. Like how is any of that bad for you? If it doesn't hurt, if you feel good, maybe you need to do more. But when did someone say like oh you shouldn't bike ride if you have osteoporosis? Like what the like what is that like? Where do you like where is like what is going on? Why is there so why are there who came up with all these rules? Who came up with all these rules? I don't know about vibration plates. Weighted vest, obviously, it's just within the context of everything we did. If you can have a weighted vest with everything you did, it's gonna obviously gonna add load, but you have to make sure you have control, stability, have an idea of what you're doing, make sure you're maintaining proper alignment, understand those principles, and it should be fine. Just know how to integrate and see where it fits. All right. All right. Questions. All right. A couple minutes for questions. Like anything burning on your mind. Anything need clarification. Anything we did. Any anything that you think I said incorrectly or wrong or that you disagree. Any disagreements. Thank you for the clients that we have. We would not be here if it weren't for the willingness for some of our clients to share this footage, just to show you guys what it's really like. I don't I don't like, calling people out. I don't like speaking negatively on other people. Everyone's trying to do their best to, grow their band and grow their personal business and to get their stuff out there. And I have nothing but respect for people that put stuff out. And we are very fortunate that we have clients that allow you guys to see what it is actually like. We don't put anything out that is not real and authentic, and we'll show mistakes. We're not going to put any instances where we're going to try to embarrass anyone or people that are in pain. But we are very, very fortunate that we have clients that are willing to help us out, and it's been helping you guys just to kind of learn more about us. So a great appreciation to the client footage that we were able to showcase, because that is the sole reason why we are here today. So all right. We will post clips. This was long. And again, I think people ask about virtual stuff. We are not there yet, guys. We understand the demand. We are very much prioritizing two things, which is our clients here and our free stuff, doing these free webinars, doing our free content. The second we start to open the door to doing virtual is we will have no time to do any of this type of stuff. Because when we take a client on, that is another medical record I need to be thinking of. That is someone's exercise progressions. I have to understand people's levels. I have to, that's just more people I have to balance up in my mind. And I've thought about it a lot, and we're not there yet until we are able to just probably like find a team to help us out for the demand. So until then, the best that we can do for the audience is to do free stuff, right? To explain everything. People keep asking us for our program. Like, do you have a program? Do you have an online program? Just shared it to you, right? We're not paywalling any of these things. We want our very best content. And again, it's not the exercises matter a lot. We want to make sure people know how to do things correctly with form, but the structural principles and the strategy that underline it is by far and away the thing that we want people to be thinking about, because it's going to be very, very difficult for people to do this on their own. And that because of how complex it is what we're doing. And as we said, the stakes are pretty high. The risks of injury are real. Uh, People are being rushed in and making decisions based off of panic and emotion and fear. And as we said, this is a long game you are playing, and we want to make sure that you take the long game approach, which is to take your time, understand the game that is that you're playing, understand the rules, understand where you're at, because your T score is not going to change based on the things you do in a month. It is going to be based off of the execution that you're able to perform consistently over a 12, no, an 18 to 24 month period, right? And that is why it took 3 hours before we showed a single exercise, is because of the principles that should be at the foundation of anyone doing any of this stuff. So that is it. Anything else, guys? Thank you so much for spending time with us on a Saturday. This one went long. I had a feeling it was going to go long. I was putting the slides together. I was like, oh my gosh, one's going to be long, but it's okay. We had fun with it. And we're very grateful that people are here and willing to sit here and listen to us for this long a time. That's why we do it. Um, Please, if people want to know how to help us out, just keep like sharing stuff on social media, keep like sharing clips, keep reposting stuff, just keep getting word out. That's all we need from you guys for right now. Is just if you find something helpful, leave some helpful comments. Maybe we get a lot of guff from some people that don't fully understand the full context of what we're doing. They just like to, say certain things. It doesn't really rattle us, because we know that there's a lot of thought and knowledge behind what we do, and we will share what we know. This is why we do these long webinars, to give full context of everything that we do. And as we said, we're gonna hopefully, as our this thing continues to grow, we'll be able to get the experts. We'll get people like, I consider myself knowledgeable about the things I know about, but I learned the stuff from other people. We'll be able to get some people on that I think will be able to add to this discourse. All right. That is it, everyone. Thank you very much for showing up to the Strong Bones Blueprint. Have a great day.